Hello, doctors. Welcome back to our another discussion session, especially for NEETPG students who just have few more days left for the exam. And many of you might be struggling with the revision without time. Most of you might have already revised 2, 3 times. There are some people who are really struggling with micro and don't have much time. So what we are going to do here is I've selected 50 questions from 50 most important, standard, always repeated question topics. So in this 50 question, we're going to cover the maximum that in a short time, it will be like one complete revision and you can go and give your exam confidently. Okay. So let's start with the question instead of wasting the time. So let's see the question. First question itself. A 21-year-old male, you can see he's an army. He's an army reserve present. That is just the basic thing what they've given. So to your emergency department complaining of worsening headache, double vision, taste change. And he states to the triage nurse his symptoms steadily increased over past 2 weeks. Okay. And then while he was in the waiting room, he had a grand mal seizure. Okay. The main thing is seizure. Before he had headache, double vision symptoms, something related to brain. And then now he's having a seizure. So something is happening inside his brain. A CT scan was done and then cystic cerebral lesion is there. Okay. When you talk about cystic cerebral lesion, you know very well whenever you talk about cystic cerebral lesion, the one thing which comes to your mind is cysticercosis, right? So everything is given to you. And even if not also, you can see in the picture given here, what is this picture you're seeing here? You see this appearance you're seeing here. So that is basically what we call it as, we call it as starry sky appearance. Okay, starry sky appearance. Starry sky appearance. You know this one, starry sky appearance. Okay. So because of the starry sky appearance one in a CT scan, this is the first clue you're getting that it is one of the thing for neurocysticercosis. Then, cryptococcosis would be the meningitis. It is the most common cause of meningitis in HIV patient. That is second one. Cerebral malaria. No, cerebral malaria, you don't have a cystic lesion. Cerebral malaria, they can have symptoms of mostly encephalitis or meningitis, but they don't have this type of symptom, especially no cyst. Neurosyphilis, the tabes dorsalis is most common one. So that also, it has totally different type of symptoms. So this is enough with the seizure and this cerebral cystic lesion to say that this is a neurocysticercosis. A little bit more about neurocysticercosis, always question asked. In neurocysticercosis, definite intermediate, both are man only. Okay, when you talk about normal intestinal tinea, then you can say the definite host is the man and intermediate is your pork or pig. Here it is not like here, both the cases it's man only, because most of the reason it is due to auto-infection. Okay, the egg, especially here the infective stage is egg, not the larva, egg. Okay, because in your teniasis, that is by solium asaginata, there the infective stage is larva, infective stage. Okay, infective stage. Here it is egg. Okay, for neurocysticercosis, it's egg is the infective stage. Autoinfection or retroperistalsis. Retroperistalsis. Okay, contaminated finger or whatever it goes back. That is the main thing, autoinfection for neurocysticercosis. Now, most common cause of, there are questions which they can ask you here is about neurocysticercosis. The neurocysticercosis is the most common cause of what? Any guesses? If you say it is the most common cause of parasitic CNS infection in the brain, means this only. One. And this is the most common form of cysticercosis. Among cysticercosis, this is the most common one. Followed by this only, other forms, you can say after neurocysticercosis, the second most common would be your, which one? Your subcutaneous tissue, followed by skeletal muscle. Skeletal muscle, subcutaneous tissue, almost second after this. Then the other wherever it goes. Okay. So these are the two common ones. Okay. After brain, after neurocysticercosis, the most common one is subcutaneous and the skeletal muscles. Okay. Two are important. And then most common manifestation, yes, seizure. When you have the word seizure in the question, you can close your eyes and mark it as neurocysticercosis. Cerebral sign, when the larva dies, usually after many years, it can take, even to more than 3, 4, 5 years. Okay, so it takes approximately, it can be like, 5 to 10 years time. Okay, it can take a lot of time. Some books is 2 years also, but like between 5 to 10 years only, it usually occurs. So these are some important points you should not forget. So in CT MRI only, just now we showed the picture. We call it as what? Starry sky. I've drawn this. This is there's one of that the if you remember the one of the cartoon channel, the pig is there, no? So you can see the pigs are watching this stars at the night. Okay, like that. Okay, Peppa the pig, you know that. Okay, Peppa the pig, that is a popular one. You can see Peppa the pig is seeing the star. So the answer should be in CT it's always the starry sky appearance. Starry sky appearance. Okay, you know this one. Serology, ELISA, Western blot you can do, but histopathology, yes. If the patient is died and if you do a brain biopsy, then what characteristic appearance is called Swiss cheese appearance. Swiss cheese appearance. You can see here the appearance. It looks like a Swiss cheese. Okay, Swiss cheese appearance. So this is another important point here. That's all. Okay, these are the important things that you should know in a neurocystic sarcosis. And of course, the drug of choice you can say usually praziquantel, or albendazole, okay, plus steroids to decrease the seizures, or anti-epileptic drugs. In case of acute, they give the anti-epileptic drugs. Epileptic drugs should be given. Okay, that's all. So these are the treatment options. Okay, so this much only you should know about neurocystic sarcosis. Know that infective stage is egg, auto retroperistasis or whatever. This is the man is the only definite and intermediate host here. Okay, and don't pork is not involved here. That means pig is usually involved in the teniasis, not here. Okay, and all these things. Most common form cystic sarcosis, seizure, parasitic after 5 to 10 years, subcutaneous, skeletal muscle, clear. Okay, so we're done with all the things treated. Now, second question. Second question, again, we are starting with actually parasitology only. Another question, another important question they're going to ask is a patient present with a calabar swelling. Already given the clue, calabar swelling is given. Okay, fine. Now, a worm crawling in the ice. A worm is also crawling in the ice. 2 points is already given. So this itself is enough to say lower. I'll tell you how to remember lower. So now peripheral blood showed a sheathed microfilaria with a nuclei extending up to the tail length. This is exactly here. You see this picture? The tail, in the tail end, the nuclei is going till the end part. Okay. So now which of the following is most likely vector? They ask the vector. Okay. So for this only I always say, I draw this picture and usually explain to the students. So you have to remember a deer, right? You remember a deer. Okay, remember a deer. Okay, deer, a beautiful deer, you can say. Okay, beautiful deer. And then what happened? You see the deer, what it is doing? It is crying. Okay, how it is crying? The deer is crying low. Okay, low. Okay, it's crying as a low. Usually cries like that, right? So low, you can remember like that, low. It's crying. Where, in which place? Malabar. Malabar is in the Kerala. So a deer crying low in the Malabar. Okay, this is the point. And you know that a deer, usually when you talk deer, okay, deer has what? This is sorry for my deer. It has this dot everywhere, right? So everywhere in the body, even in the tail, it has dot. Okay, even in the tail, it has a dot. I'll tell you why I'm talking about the tail here. Okay, you have it here. Okay, now let's talk about this. So it has tail everywhere. So now, why did I say deer? Because this is deer fly. Okay, it's caused by deer fly. The deer fly is also sometimes, the deer fly is also called as, the deer fly is also Chrysops. I say because of chrysops. Okay, chrysops or deer fly. They are same. Chrysops. Okay, chrysops. Lower disease name. Malabar, you make it a calabar. Calabar swelling. Okay, so this is basically eye worm. Everything is about eye here. So we call this as a eye worm also. Okay, eye worm. Got it? Very simple. So now you see, based on all the clue, I'm going to what? I told the deer is crying in the low. It's crying low in the Malabar or Calabar. So your answer is Chrysops. Easy. Okay. Did I mark the previous question answer? Yes, we already marked cystic sarcosis. Okay, cystic sarcosis we marked. Okay, now here we marked the answer is your lower. So here the main thing is the tail end. In tail end, if it goes till end, the nucleus go till end of the tail, the microfilaria, it is lower. So you can remember like this also, lower. Line of nuclei. You can say line of nuclei, lower. Full of nuclei, line of nuclei. Same way, if it is empty, then it is elephantiasis. If it's empty, it is elephantiasis. Empty elephantiasis. Or you can remember also with picture I used to tell my student, a big elephant has small tail. So there is big elephant has small tail. So there is no nuclei. Okay, no nuclei. That's all. Okay. Whereas this is for elephantiasis. Okay, this is for your lower. LL, no, lower. So line of nuclei. You can remember like this. Okay, number 1. 2 for elephantiasis, no need. Third one is Burgia malai. For Burgia malai, you'll have only 2 nucleus. Okay, that is Burgia malai. If you forgot also, remember always Malay. Malay is a human, right? Malaysians. Remember like a Malaysian. Okay, Malaysian having a tail and has a two nucleus. Okay, one for him and one for his wife. Okay, just 2 nuclei. One for the Malaysian, another one is for his wife. Remember, like that also easy. Okay. So Malaysians have two nuclei. Remember, like that easy. Okay. Lower line of nuclei. Elephant is empty. Okay. So, and for Burgia Malay, you have two nucleus in the tail end. That's it. This you know very well. You should know. This is important question. Okay. Yes. So lower I've written here. You can see this also. So what is important here in lower is, once again, let's change the color. Okay. Yes. So lower transmission vector, just now I told you chryshops, okay, or we call it as a deer fly. This is basically African eyeworm, they call eyeworm is other name. Clinically, you can see this swellings which you call is called as the calabar swelling. Okay, and see in the other picture, you can see the eyeworm, you can see. That can lead to multiple things, conjunctivitis, keratitis, so many things. But for us, this is important. Calabar swelling with this eyeworm manifestations, if it's there, then it is definitely your, this, you will tell it is a lower. Okay, that's all. This is one thing. Next one. And also don't confuse with the river blindness. You have a river blindness. River blindness is basically caused by which one? Black sumo will fall down, right? Black sumo. So that is black fly, which also called simulium. Okay, black fly, which is causing river blindness. So I always say you simu, who is going in the, so this is basically caused by, you know, what is that called? It is called a river blindness is called by Onchocerca volvulus. Okay, Onchocerca volvulus. I told Simu going in the Volvo bus, black Simu, he's going in the Volvo bus, and suddenly what happened? He's going on the bridge, right? He's going on the bridge. And what happened in the bridge? This is the bus. He's going on the bridge, and suddenly what happened? The bridge falls down into the bus will fall into the bridge, okay, the river. Down is the river. So Simu is going inside, the black Simu, he falls into the river, okay, black Simu falls into the river and he gets the river blindness. Remember like that, okay. So these are the few words, just if you forget in the last moment, remember it like that, it's very easy, okay. So river blindness is onchocerca volvulus, but your lower is your lower causing your, it's an eyeworm, basically it's an eyeworm, calabar swelling, okay, that's all. This one you have to remember, okay. So these are important points. Next one, even before going to the question itself, I'm just going to see this picture, and you see for me already got a clue. I see a lot of O's here. O like this. O comes. All comes as hookworm. Okay. Hookworm. See like this. O. Here also you see a lot of O's. Okay. With a clear space. Outside. You have a clear space outside. Okay. Outside this embryo. Okay. So this like this round shaped embryos inside, and with the clear things comes even without anything, only what I think hookworm. Whenever you talk about the hookworm, you have only two things that comes into your, only two things will come into your mind. I'm going to talk that this in a while. Okay. So only two things will come in your mind. What are they? One is your two things, that is your, one is the Ancylostoma duodenale, and other one is Necator americanus. Okay, but still we'll go to the question. So here they told that the patient is having severe weakness and pallor. Okay, looks like anemia. Okay, my first guess. And then reduced hematocrit and hypochromic microcytic RBC. That is more than enough to say that anemia, iron deficiency anemia. Okay, with increased eosinophil, which is common for all parasites. The investigating possibility of parasite, the physician orders a stool sample which showed the numerous eggs were there, and this is the eggs picture they've given down. So they've given prescribed albendazole and iron tablets, and the child may, and explain that child may occur the illness by walking barefoot. That's another way, another important point. And then, so all this together, my option is going to be either Ancylostoma or Necator hookworm. So here we have given only Necator, so Necator is our answer. Okay, so Necator americanus will be our answer. Okay, now some important points here. If you see, infective form, you know that there is only three parasites. We are talking about roundworms. We are in the roundworm. These are the roundworms. Okay, in helminth, these are the roundworms. Okay, so they are also called nematodes. These are nematode. Very few of them, they go because they occur because of barefoot. Okay, barefoot. How to remember it? We know that if someone wants to walk in the beach on the sand, okay, they want to walk sand. Okay, sand. Let's remember sand. So in sand, you walk barefoot. So S stands for, what is the S stands for? S for strongyloides. S for strongyloides. S for strongyloides. A for ancylostoma. Ancylostoma. And N for Necator. Whereas these two are hookworms. So remember three things. You walk in the sand barefoot. You walk in the sand barefoot. Okay. So this is the clue for you. So one question can be, especially strongyloides also they can ask you. Okay. So adult worm will take it try to, with the hooklets, it's try to suck the blood, right? So you get what? Iron deficiency anemia. Okay, iron deficiency anemia. That is basically hypochromic. We saw that hypochromic anemia. Okay, hypochromic iron deficiency anemia. That is one thing. Because you have also megaloblastic anemia, which is caused by, when you talk about megaloblastic anemia, megaloblastic anemia is caused by Diphyllobotrium latum, right? That is caused by Diphyllobotrium latum. So two important anemias we have. So remember this, okay? Iron deficiency comes here and megaloblastic goes there. Okay, that's important. Larva migrans. When we talk about larva migrans, yes, this is the one, cutaneous larva migrans. The picture which you're seeing here, this is you can see here, it's running here and there. This is the one, okay? So this is cutaneous larva migrans. All the three. Cutaneous larva migrans, because we already told it is cutaneous, it's penetrating the skin, right? These worms, they're penetrating the skin and they go inside the body. So definitely they're cutaneous larva migrans it causes. Okay, that's very, very important. So this is what you're seeing. So they cause larva migrans, which is basically called cutaneous larva migrans. Chandler index. Chandler index is basically, when there's more than 300 hookworm eggs, then that is a community problem. Okay, that means there is a outbreak or whatever. Okay, more than 3 hookworm egg per ml of stool. So that is Chandler index for epidemiological purpose. Okay, right. That's all. This is for your hookworm. Next one, look at this picture. Again, definitely one egg is going to come. Most of the time it is asked, so you should be thorough with the eggs only. So look at this question here. A 46-year-old patient travel to Africa with a painless hematuria. Okay, first clue, I'm getting a painless hematuria. And on urine examination, the below egg was given. Okay, look at this beautiful egg. First of all, painless hematuria. So that is something related with the bladder, urinary bladder. Okay, something related with the urinary bladder. This parasite is affecting the urinary bladder. And then whenever the urinary bladder comes, you know very clearly that is only one, that is cystosoma. Right? Cystosoma. Especially now, cystosoma we have 3 times. Okay, cystosoma. This is terminal spine. T terminal spine, terminal. So this is again where we discussed a lot. This is cystosoma because T is there. Hematobium. Okay. Here the most important thing of hematobium is that it causes squamous cell carcinoma of your urinary bladder. Okay. Squamous cell carcinoma of the urinary bladder. Very, very important one. And also other point regarding cystosoma, because everything is starting with yes. It goes to the skin penetration. Okay, it goes to the skin skin. It goes to the skin penetration. Okay, penetrates the skin. Number one, okay, penetrate the skin. Second one, here the sex are separate. They have separate male and female, not hermaphrodite. Okay, so that's another point. Yes. Second one, they have spines like this. These are the spines, the spine. So another spine, another yes has come. Okay, all yes. And always remember, I told sister to remember at cis. These are coming under trematodes. Sisters, the egg is usually, they completely cover them. So it is non-operculated egg. Okay, it's non-operculated. All other eggs in trematode are operculated. This is non-operculated egg. So these are few important points just for this. Okay, now you look. So when I say skin penetration, the form which is penetrating is Cercaria. Okay, it sounds yes only, Cercaria. So everything is yes. Okay, right. Now let's go to the option. So this one of your previous year also some more question came similar to this. So that's what we were stressing on this. Infective form is Cercaria. Definitely yes, this is correct. The question was asked is which of the following is correct? Yes, this is correct. The mode of infection is by ingestion? No. We just spoke that all the cystosoma goes by skin penetration. So it should be skin penetration, right? And then usually transitional cell, no, we just spoke. Everything is squamous. So everything is here. So squamous cell carcinoma. Okay, so that was another point. Okay. Then drug of choice is triclopentazole. No, why triclopentazole? Triclopentazole usually we give only for fasciolopsis. on fasciola. Okay, usually fasciola hepatica, we give this triclobendazole, that to tricolor phase, you're putting tricolor, remember like that I told. So here it is usually same praziquantel only, praziquantel, which is common for all these things. Okay, praziquantel. So, so only it looks like only the first one is correct. Only one option A is correct. Rest all are wrong. Okay, so this is the important one. Okay, fasciola for triclobendazole for fasciolopsis, and praziquantel you give for most of the trematodes and cystodes. Okay, yes, that's all. This one. So when you talk about the trematodes, trematode is given here. It's a flukes. We usually call it as flukes. Okay, and here trematodes usually they require three hosts. That means one definite host, and two intermediate hosts. Two intermediate hosts you needed. Okay, right. But here always man. Okay. Yes. Now here what happened? The second was first. The definite host was always man, and the intermediate host. The first intermediate host is always snail. Okay, it is always the snail. Okay, for all. And one thing in cystosoma, no second intermediate. We have only one intermediate host. Okay, snail. Only snail is there. There is no second intermediate host in cystosoma, where all others they have. Clonorhynchus, Fasciolopsis, they all have second host. Even your Fasciolopsis, everything has second intermediate host. Here, you have only first intermediate host, that is your snail. Okay, that is important point. Definite host always met. Okay, so this is about intermediate host. Yeah, first intermediate host. I'm just going to cut this, but this is not needed. Okay, when you talk about intermediate host, the first intermediate host snail for all, and there's no second intermediate host for cystosoma, but all other trematodes they have. Okay, that's another important point. Okay, mode infective stage, infested throat. Of course, it's the egg. Egg. When you talk here, you see the diagnostic form here. Usually, infective stages for other people, it is the metacercaria in the oral route. Okay, metacercaria oral route, but only for your cystosoma, only for cystosoma, it is skin penetration by our cercaria. Okay, again repeating it again and again, this is important. Okay, so yes, everything goes with yes. Okay, yes. So now if suppose they give this picture say to identify, you have to class the cystosoma is three important species we have. So you see this based on the spine only we classify. This one we already told, the terminal spine. I'm seeing the terminal spine. Here I'm seeing the spine on the side, lateral side. Okay, spine on the lateral side. Here, a small knob, okay? A nose or knob I'm seeing in this egg, okay? So you know that this is a beautiful girl. If you see this beautiful girl, Mansi has a pimple on the side part, okay? So this is basically cystosoma Mansoni, okay? Mansi has a pimple on the side part. Whereas your terminal, we just for cystosomia hematobium. T for terminal, T for tobium, hematobium, okay? Hematobium. Okay, and your nose, this is a small one. Who has, which country people are small? Japanese. So cystosoma japonicum. Okay, cystosoma japonicum. Okay, but the only thing is that this is only affecting your bladder. This is affecting your urinary bladder. But the other two, they affect GIT. They cause the GIT symptoms. You also call bilharziasis, a Katayama fever we call. Okay, so those are other things. Katayama fever will come for Manzoni and Japonicum. Okay, Katayama fever. This is causing bladder carcinoma. Okay, that's all. This much only you should know. Very easy. Now, next question. Another very easy question, repeated question. You know that here, 15-year-old female brought to emergency room in unconscious state. And she was well until 3 days prior, and she completed a fever with chills and frontal headache, fever with chills. And then other relevant hepatomegaly is there, and no any tenderness or other organ. Okay, a urethral catheter was passed, and urine was monitored using coke color urine with hemoglobin urea, right? Hemoglobin urea. The peripheral blood smear was stained with Giemsa. The image was shown below. Which of the following is the right statement? Okay, now look at this picture. Clearly, you can say what I'm seeing. I'm seeing a banana or crescent shaped. Okay, banana or crescent shaped site. This is first clue for me. The basic pictures, if I know that this is falciparum. Okay. Now look at this. All these symptoms, urinary symptom, you can see that unconscious state, cerebral malaria. So there is cerebral malaria, black water fever. This is this black water fever we call, because RBC breaking down going to the kidney. Black water fever is there. Okay. So that's what color urine. All these things comes here. Now color urine also seen in the post-acute glomerulonephritis. Here also we call it sort of black color. So we call it like that only. Okay. A black water fever. And then Jimsa was done this picture. So everything gives me clue of which plasmodium? Plasmodium falciparum. Plasmodium falciparum. Falciparum is the dangerous one. This is the most dangerous one. So I told you who are dangerous in the world. Anyone related with Chinese, it's a bit dangerous. So let's put as Mao. Okay. Mao is dangerous. Maoers. Okay. Mao is the dangerous people in the world. So anything with Mao, it's dangerous. So Maoers, that is one thing. And you know that it is China people. China people are the one, they have what? They are having what? They are the one who invented, you can say, your earphones. All your earphones was invented by them only, right? One thing. And they are very greedy, so they have multiple rings. Okay, they have multiple rings they have. Okay, and then they always call this recrudescence. Recrudescence is fast occurring, reoccur very fast. Okay, and normal drugs will not work. We have to give advanced drug like what? ACT therapy. Okay, artesunate combination therapy or artesunate, these type of combination drugs only you can give, otherwise it will not work. Okay. Okay, now let's go here. So sharpness dot is seen. No, sharpness dot, Schaffner, I always give a clue, Schaffner, Duffy. Both are related with what? Plasmodium vivax, Vivek. They are Vivek's girlfriend, right? Vivek's girlfriend. Schaffner and this is Vivek's girlfriend. Hypnozoid is also for Plasmodium, Plasmodium vivax and Plasmodium ovale. Okay, not for this, not for our falciparum. Acolform, yes. Acolform is the characteristic. When I say this earphone is basically the acolform. So acolform is characteristic, definitely yes. Chloroquine treatment, no. Chloroquine is used only for Plasmodium vivax we're using, because for it's not working for falciparum. That's what we're giving, artesunate combination therapy. So this all go for Plasmodium falciparum. Okay, this much is more than enough. You know these points and you can do it. And please remember, in Plasmodium falciparum, we know late trophozoite stage, no late trophozoite, and also there is no Sejong stage. Okay. No Sejong. You have gametocyte and early trophocyte. This is not there, because these things, they adhere to the blood vessel. They don't come to the blood. Okay. They usually stick to the blood vessel walls. Okay. Capillaries, blood vessel walls. So they don't come to the blood. So you usually don't see it in the blood. Excuse the peripheral blood, you will not be seeing this. Okay. That's the main thing. So if you see the next picture, little bit pictures. Here you can see, I told you multiple rings, right? You're seeing multiple ring. This one on the this is again your Plasmodium falciparum. You're seeing multiple rings. Number one, and you're seeing a cold form in the corner. If this is the RBC, on the corner of end of the RBC, you can see something like earphone. These are called acol. All these things are for falciparum. Okay, and you see single ring. When you see single ring stage, I always say Vivek. Vivek always says he has two girlfriends, but he always says I'm single. Okay, so remember, okay, single. This is a band form. When you see a band form like this is you seeing a band. When you see a band form, that is your Plasmodium malariae. Plasmodium malariae is one special one where you will see a band. Okay, that's all. Here, this is again gametocyte, but oval gametocyte. Gametocyte, but it's oval, not banana shaped. When it is oval or round shaped, you think about what? Plasmodium vivax. Vivax and falciparum are the most common in India. So these are the things only. Okay. So these two pictures, this picture and this picture are for Plasmodium vivax. And apart from the banana shaped, if you see this multiple ring and acol that is your falciparum. Okay, falciparum. What about this one? This disease again, it's almost similar to malaria. Only thing is that you're seeing something like this. What is it? It's a cross. We call it as a Maltese cross. So who is causing this? They have symptoms same like malaria, only this is different. Babesiosis. Okay, babesiosis. We call it as babesiosis, which is transmitted by tick. Yeah, heart tick we call. Okay, that is important. That's all. Okay, so this in picture wise, if they were to ask anything related to malaria, so any of these things can come. Okay, so you know this one. Now, next question. Next question. You can see here a 23-year-old male from rural village, history of swimming. Swimming is enough for me. The word swimming come, my mind will think about Naegleria only. Sometimes it can be acanthamoeba also. Okay. So swimming, he presented with a complete headache, confusion, and vomiting symptoms were the typical meningitis symptom. And then what happened? The physician suspected a parasitic infection. He sent CSF for a culture with this, which ultimately is most likely to be isolating from this organism. Okay, definitely this is one of the free living amoeba. This is more for me it's more looking like a Naegleria because the symptom itself looks like what it's looking, head confusion, etc. It looks like a, I always say what, Nigel girlfriend is Pamela Anderson, Pamela. Okay, Pamela. So why did I say Pamela? Because that is primary amoebic meningoencephalitis. This word is very, very important. Meningoencephalitis. Okay, encephalitis. Same way, there is another one. This is for your Naegleria. Okay, I'm thinking of Naegleria. Another one is your acanthamoeba, another free living. Acanthamoeba. Acanthamoeba, I told is here. It's given here and I don't even go there. So this is your Naegleria. This is Pammy. Okay, Pamela Anderson's girlfriend. That is primary amoebic meningoencephalitis caused by Naegleria. Here, this is our acorn. Acorn, I told always remember as a gay, because the disease caused here, it's called granulomatous amoebic encephalitis. Granulomatous amoebic encephalitis. Okay, encephalitis. So you can see here, this is how it looks. Some amoeba form, amoebicule form. Like here, you know that it's because of contact lens. Acorn is a gay, so he wears a lot of contact lens to look colorful and he gets keratitis, right? We said like that. And this is a typical what? Spike. I can't miss spike. So being gay, so he always makes spikes on his eye. Remember like that. Okay, that's it. And double chin cyst, we can see there's one double chin cyst, but mainly this is important. Spike. Okay, this is a trophozoite with a spike. You can see here. You can amoeboid, just simple amoeboid form. You can see the Naegleria. So now important for both this. Both are called as free living amoeba. They both grow in which media? They grow media called nutrient. It's not nutrient agar, non-nutrient agar with E. coli. Basically, it's a non-nutrient agar with E. coli. Okay, because they don't feed on the nutrient, they feed on the E. coli. When they feed on the E. coli, when they eat, you can see a track-like appearance. So when you track-like appearance means it is either Naegleria or acanthamoeba. So this is one specific. Okay, non-nutrient agar with E. coli is a classic media for your Naegleria fowleria and acanthamoeba. You can expect this question. So all the pictures, everything I've written here. And remember, Naegleria fowleria, it's worst prognosis. The patient dies within a day. Patient dies fast within hours. Okay, within hours he will die. That's what it is, rapidly progressive. When I say pammy, the reason for this is called as, I already told, primary amoebic meningoencephalitis. Primary amoebic meningoencephalitis. Okay, that's all. So this is one thing you can't forget. Very, 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 very important. Okay, so one thing we have to remember. Okay. So next question, that's easy, right? Now, this is again standard. Next question is 100% guaranteed question every year. Now in FMGE exam also they have asked recently. Every year I'm seeing this question is not missed by a microbiologist. Okay. Now let's see this one. In a HIV patient, chronic diarrhea was there. So on stool, of course, chronic diarrhea, always we think about some acid first parasite only. So acid first stool, cyst of 4 to 6 micrometers given and the image is seen. Okay, 4 to 6. So before, and then they have told you to say the organism and the treatment for the same. So because that will go short, briefly, we'll go very quickly. You have to tell me now. So the first one, the smallest one is your cryptosporidium, smallest one. Then comes the cyclospora, and then last one is your isospora, but nowadays we call it as the cystoisospora. Okay, cystoisospora. So don't confuse, they are same only. Okay, cystoisospora or isospora. They're not giving any more isospora, right? Okay, now look at this other options. So cryptospora, when you talk about, first we'll talk about the size only. When you talk about size, this is the smallest one. How much will come? It is usually 4 to 6 and 4 to 6 micrometer. And if you double it here, it will become 8 to 12 micrometer. Again, this you double 24 to 36 micrometer. Okay, this is the first point, size. Very, very important is size. Second one, all are acid fast. That's what it is saying. Okay, acid fast is positive for everyone. This sometimes may be less, but yeah, mostly all are positive. There's a property called autofluorescence. Autofluorescence, when you talk about autofluorescence, they will fluorescence themselves. Crypto, no, there is no. But these two, yes, they both have the autofluorescence property, right? Okay. Now, next, another thing is, these are the main property. Size, the acid property, autofluorescence are very, very important. Now, next one is your treatment. For treatment, see, we always talk about cryptocurrency. Whenever we talk about cryptocurrency, all that comes to your mind is Nita Ambani, right? Nita Ambani is the one which comes to your mind. So, Nita Ambani means the drug of choice will be Nitazoxanide. Okay, nitazoxanide. But for other two, it is basically what? Other two, it is basically cotrimoxazole. Cotrimoxazole for both. Okay, for both it is cotrimoxazole. That's it. This is the treatment. Very simple. So based on this one, now you can go to the option. So this, you see, the size is 4 to 6 directly given. So it is cryptosporidium, number one. Number two, drug. Crypto means cryptocurrency, who's Nitambani. So my option is 2, cryptosporidium and nitazoxanide. Okay, rest does look. Here it cotri, not cotri, it is nitazoxanide. That's all. Okay. So we give nitazoxanide syrup to the children if it's child, and accordingly to. So you know that most common cause of these are the species calling most common cause of diarrhea, especially crypto is most common cause of diarrhea in HIV patients. Okay, that's it. This is the important point you should know. Okay, easy. Now, next question. This is also by seeing the picture only, you already know it for sure. 35-year female, vaginal pain after sex. Greenish frothy discharge. Greenish frothy discharge, number one. And then they're given a Giemsa stain. I'm seeing a picture down here. Look at this picture. It's a single. Everything is single here. What do I mean by single? Here, if this picture, this parasite, only single nucleus is there. Okay, single nucleus is there, right? Okay, we'll stop there. Now we go. So we are talking about someone, Trisha. We are talking about a Trisha here. Yes, so this is our Trisha. Okay, her name is Trisha because this is Trichomonas vaginalis we are talking. Okay, Trichomonas vaginalis. So here, if you see, look what she's wearing. She's wearing a diamond necklace, and then she has this beautiful eyelash, right? Eyelash. She has a beautiful eyelash. Also, not only that, if you see on her side face like this, I always draw this picture. In the front, she has 4 hair, and on the back side, she's having single hair. Okay, I mean to say one flagella in the posterior side, 4 flagella in the anterior. So totally there is 5 flagellas. Okay, that's another important point. That's Trisha's. Okay, with a beautiful eyelash, diamond. Right. Next one is. So why we say diamond eyelash? Because the media name for this is diamonds media and lash cystine media. Culture media. That's what we have given this name. Okay. Other important thing is that Trisha is single. Why? There is only trophozoite stage, no cyst stage. Only trophozoite, no cyst stage. That you must know. And it has only single nucleus. Whereas your giardia has 2 nucleus. Here you have only single nucleus. Okay, that's another important point. Okay. And the motility, T for twitching. It has a very typical twitching motility. Another point. Okay. And Trisha's favorite food you can see is strawberry. She loves strawberry with green. Anything comes with green discharge, you think about this. And strawberry, because strawberry vagina. And pear shape. This is usually pear shape. Sometimes they call oval also, doesn't matter. Even giardia is also called pear shape. But this property you can say. So everything fruit related. Strawberry because strawberry vagina. Green because green discharge. Green frothy discharge. Okay, frothy discharge. This is the strawberry vagina you're seeing here, and then the pears. Okay, that's all. So the treatment is, of course, metronidazole. You know that one. Okay. So now let's go to the options. Clue cells are characteristic? Definitely not. Clue cells are for bacterial vaginosis. That is Gardnerella vaginalis. Bacterial vaginosis. Gardnerella vaginalis. It will not come here. And that is used in the Amsels and Nugent's criteria, doing Amsels criteria. Both the trophocyst, no, it is wrong. So this is also wrong. Why? At was Trisha single, only trophocyst, no cyst stage. pH is less than 4.5. No, this is for Candida. Only Candida has a pH acidic pH. Rest all are alkaline. This is above 4.5. Okay. So organs exhibit twitching motility, definitely yes. This is the right answer. Okay, it exhibits twitching motility. So this is your typical Candida. So, and don't forget, it is giving you what is the discharge you see, greenish frothy. When the word greenish frothy comes, you think about this one. Okay. Treatment is metronidazole. Fine. Okay. So we're done with the trichomonas vaginis, another important topic. Next. Which of the following is incorrect regarding the giardiasis? They talk about giardiasis. Okay, talk about the giardiasis. So before going to the thing, let's just do a little bit this thing and then we come back. This is a tennis racket. This guy, he's why he's having tennis racket? Because tennis racket, okay, tennis racket. He hits this Gia vegetable. He doesn't like it. So what happened when he hits with this tennis racket? Gia falls down. Okay, falls down. Okay, falls down. So what I meant to say, appearance. So this is the appearance. You see, it looks like a tennis racket. When I say this one, so it is because tennis racket appearance shape. Okay, the shape is tennis racket. And why say Gia? Because this is Giardia. Giardia falls down, falling leaf motility, because it is falling leaf motility. That's all. Okay, look at this here. If you see, the two nucleus will be there, two nucleus. Okay, and then you, how many you have four pairs of flagella, or simply it is total 8 flagella. Okay, 4 pair or 8 flagella we have, whereas in Trichomonas we have only 5 flagella totally, one posterior, four anterior. Okay, and then two nucleus is present. That's all. Okay, that's another point. Here, another important, all the symptoms usually whenever you get GIA, you get steatoria. Steatoria means basically it's a foul smelling, it's a fatty diarrhea, fat diarrhea, fatty or lipid diarrhea. Lot of lipids you can see, foul smelling also, very foul smelling, foul smelling. Okay. Next one is your this one. This test is called entro test. Entro or called string test we call. Okay, entro or string test. Very important. This is because you put a special capsule like this, capsule with the thread. It will go till which for duodenum. Duodenum, upper part of GIT, duodenum. Because if you forget also GIA or DIA, giardia, duodenum. So only till duodenum it go and leave it, and you take it out and put it. If you take it and make a snare and see, we will look for the trophocyte or the cyst. Okay, you can easily, because it's present in the lumen, so easily you can get attached to the capsule, then you can make a smear and see. That's what we can do, the entro test we do. Okay, fine. So these are the basic points we have discussed. Now let's see. Stool examined for cyst in every 2 to 3 days into once again, the option question is incorrect statement. Okay, fine. So the stool examined cyst for every 2 to 3 days. Yes, it is shredded intervally only. So every 2 to 3 days interval, you have to check until to confirm it. Okay, this is correct option. Colonoscopy aspirate gives highest diagnostic. Colonoscopy, not colonoscopy. You do why to do a colonoscopy. Colonoscopy is you're coming from backside anal region. No, it is usually duodenum. So this is not the right. This is wrong. So this is the answer actually. Okay. So next one, most likely, next one is occurs by ingestion of contaminated. Definitely yes, it's contaminated. Giardia has a flagellated trophozoite form. Yes, it is a flagellated only. That's what does 8 flagella. That's also right. So colonoscopy is a wrong answer. Okay, entros test we do, but we don't need colonoscopy. Colonoscopy is for lower GIT part. Okay, so what is the use? So no, so that's the wrong statement. Okay, that's all. Treatment, of course, metronidazole, right? Metronidazole for giardia also, metronidazole for trichomonas also, because the shortcut, you remember, get out of the way. I told, get out of the way. Metro train is coming, right? Metro train is coming. G for giardia, E for Entamoeba histolytica, T for Trichomonas vaginalis. Okay, all these things. Metronidazole is the treatment. We talk about the treatment. That's all. Okay, fast revision. Look at this picture. One guaranteed picture you will get. FMG, they didn't ask this time. They asked something different, but here you can get it. So look at this first picture. What I'm seeing. If you come with me, it'll be easier. If you just go with my this thing, whatever I'm going to write here. 1 second. Okay. Look at this picture. The first picture, I'm seeing a club shaped. I'm seeing a club shaped macroconidia. Okay, club shaped macroconidia. Club shaped macro. Second one, I'm seeing, see, this is a pencil. So I'm saying pencil shaped macroconidia. Pencil shaped macroconidia. Okay, macroconidia. I'm going to say macroconidia. Okay, macroconidia. Third one I'm seeing, so it looks very much spindle. Okay, spindle shaped. Spindle shaped macroconidia. Spindle shaped macroconidia I'm seeing. The last one, I'm seeing a beautiful spaghetti. I'm seeing a beautiful, delicious spaghetti and meat. Spaghetti or meat. Or sometimes what I'm seeing the banana and grapes. Okay, so these are spaghetti and meatball. Or you can say banana grapes. Or banana grapes. Okay, this will already give you clue. So when I say club, I always said, who owns a club? The guys with the name called Ebi, right? With Ebi means Ebenezer, they call. They are the owners of the club. So this is basically epidermophyton. Epidermophyton. Okay, very important. Pencil. Pencil, always I tell, try to write with pencil first, right? Try to pencil. Why say try? This is trichophyton. Trichophyton, very simple, trichophyton. Okay. Spindle. Spindle, when I say spindle, with that, or spindle is like a micro, no? Micro spindle, micro spin we call. So many names are there. If you forget also, okay. So here, micro sporum. Microsporum. S for spindle, S for sporum. If you forget also. You have a clue. Or microspindle, you can say. Microspindle, however you want. Then last one is spaghetti meatball appearance. It's classes who loves this. Mala likes it, right? Mala. Mala's favorite. Mala's favorite is spaghetti meatball. Mala's is here for. Pitriasis versicolor, right? It's a pitriasis versicolor. Usually it causes pitriasis versicolor. Very, very important. This is definitely one question. So now you have to match with the right options this side. Okay. So when you talk about epidermophyton, we already say skin is affected everywhere. Skin and epidermophyton, it ends with phyton, N, right? N for nail. So skin and nail. So where is the skin and nail? This one. So A goes to 4, number 4. Okay, skin and nail. What about this pencil trichophyton? I always say try. Try means 3 things should be there. All the skin, hair, and nail. So this goes to C. B is this hair, nail, and tail. Okay. Microspore, we know nowadays our hairs are becoming very micro. So hair. So I'm going to talk about hair and skin and the hair. Skin and the hair. Okay. What about the last one? Spaghetti meatball appearance, Pityriasis versicolor. Mala has small what? Hypopigmented, mildly icteric or non-icteric lesions. Okay. Hyperpigmented patches. Basically hypo. So I'm getting a non-puritic hypopigmented patches. That's all. Very simple. Okay. So this way you can make the mark the answer. A is 4. A4, B1, A4, B1, yes, right. That is only one option, A for D, option D. Okay, very simple. In this way, you'll get one question for sure in this topic. So be ready with that. Okay, now next. Again, classic question. Expect also, this is also frequently asked. AIDS patient, fever, vomiting, neck rigidity. So meningitis. So it's meningitis. Now, which of the following help in the rapid diagnosis? They asked about the rapid diagnosis. Okay. So the symptom is meningitis. In HIV patient with meningitis means always you think about cryptococcus. Okay, cryptococcus. So in cryptococcus, usually cryptococcus, the specific is capsule is the main virulence factor there. Capsule. And it's because of what? Pigeon droplets. Okay, pigeon, nowadays pigeon becoming very dangerous. Everyone is saying to avoid contact with pigeon. This reason, because crypto is increasing day by day, especially when CD4 count in HIV patient goes less than, how much? Less than 200. It comes in less than 200 category itself enough to get it. Okay, fine. This is some important points we told. Now you can see that they ask for rapid diagnosis. Indian ink, yes, correct. For capsule, it is correct, but it's not for rapid. It will take little bit time. Not immediately you can do it. Blood culture, yes, we can do. Why not? Because it can cause go to blood also. We can do CSF culture also, right? But this takes a lot of time. It takes more than minimum 48 hours. Definitely needed. But this one, your blood lateral flow assay, definitely yes. Or latex, both are correct, okay? Or latex agglutination test. These are the, nowadays lateral not much done, but still, it's also fine. The lateral flow assay is basically that card test, that card test you put it, and if it comes positive. It's more sensitive and even more specific, we can say, for cryptococcus. So you can use it, okay? So that's it. So easily, your answer is D, okay? That's all. Fine. Now look at this. So this is your India ink, which is showing cryptococcus. Cryptococcus is basically oval-shaped budding yeast cell. Say yeast, budding yeast cell. So the capsule, you can see the outer capsule is stained. So India ink, that is negative stain. You're going to do a negative stain. Negative stain means, either it's India ink or Negrosin. Okay, for capsule. We are the negative people. Indians and Nigerians are negative people, and we are wearing cap. That's all. Simple. This is a birdseed agar. We're talking about pigeon. So remember, birdseed agar also come. Birdseed agar. So here you will see the brown color colonies. That is the point. Okay, that's all. This is for your cryptococcus. And treatment amphotericin B you have to give because it's usually systemic. Right. Look at the next one. Again, mycology. This is another examiner's favorite question. You can't leave this. You can come with me. I'm seeing a body. What is the copper penny? What I'm seeing here is a copper penny, also called medlar or murrayform. You remember it? So many names of the copper penny, medlar, murrayform, sclerotic bodies. These are sclerotic bodies. Murrayform cell, medlar bodies, copper penny. So many names are there for this. It looks like a copper penny only, like a coin only, right? That's one. Look at this one. Here I'm seeing acute angle. Acute, okay, acute angle because it's this much only, less than 9, like 45 degree. Okay, acute, and everywhere I'm seeing septate. Acute septate hyphae. Acute septate hyphae. I'm seeing acute septate hyphae. Okay, yes. Here I'm seeing wide angle. Wide angle. You see the angles are wide like this. See, it's like this. So there is no angle only. I mean broad angle. Okay, wide angle, and there is no septa. There is no septa. Aseptate. Aseptate I'm seeing. Aseptate hyphae I'm seeing. This is another one. Okay. So all are important questions. That's what I made it like this. Here I'm seeing a beautiful flower like, okay, like a star. It looks like a star. So I'm talking about asteroid body. You have definitely asteroid body or medullary body, and highly expected question. Okay. So when I see this copper penny medullary and all, anything like the related with the something metal, no, something related with the chrome, something related with the chrome sort of thing, chrome sort of thing. So what I'm going to think, I'm going to think this as a chromoblastomycosis, chromoblastomyces. Okay, chromoblastomyces. Acute septic, the name itself as AS, so that is aspergillus. Aspergillus species, something related with aspergillus. Wide angle aseptate means W you can make as M, so it become mucormycosis. Mucormycosis or a zygomycosis. Nowadays we call mucor only, no more zygo. Okay, got. Asteroid body is asteroid body. You know who watch asteroid is a star. Who watches star at the night? Rose Gardner. Gardner. So Gardner means sporothrix. Sporotrichosis or sporothrikosis. This is Rose Gardner disease. We call Rose Gardner disease. Okay, now the disease is fine. What now the organism you found, what is the diagnosis then, but what is the disease it causes? So chrome blast agar means is if it comes in the farmer and it causes the warts like lesion, warts. So this is basically varicose dermatitis you call, or you call it as the warts. On the leg part, in the farmers, they have the special warts like lesion. That is your chromoblastomycosis. Okay. Second one, this is aspergillosis causes anything with lung aspergilloma or allergic alveolitis, bronchitis, bronchial asthma exacerbation, all those things. So I'm already seeing allergic bronchopulmonary asthma. I'm got it. So this is this option. Mucormycosis, everything related with your upper part, especially ENT related, reno, orbital, cerebral, mycosis. Okay, so exactly. So this is the one. Reno orbital. Everything goes black color because of gangrene, fast spreading, and it's dangerous. In COVID time we had. So that's what it is. Very dangerous. Everything goes black color. So when this type of things happen black color, so then I'm going to think about mucor. Last one is a asteroid. Gardner, Rose Gardner. Rose Gardner means if again in the arms or in the hands, what happened? You'll have row of ulcers. Along the lymphatic, you'll have row of ulcers. So I'm going to put this one. That's it. Very simple. So one question surely you'll get from here. So option A is 4. A is 4. B is 3. A is 4. B is 3. Yes. First option. Okay. A 4, B 3. C is A. And then this thing. Fine. Even if on that options we already marked it, so you know it. Okay. So this is one. Don't forget. Definitely one question from this part. Surely guaranteed. Every part now I'm coming. These are guaranteed questions. Now another one again. Mycology. Examiner's favorite question. Look at this one. Here, this is looking like a broomstick. Broomstick. Okay. Broomstick. Or we call it as a painting brush. Or we call it as painting brush, you can say painting brush. Okay. What about this? Here, this is tuberculate. You call it as tuberculate conidia. Tuberculate macroconidia. This is tuberculate macroconidia. Macroconidia. This is your arthrospore. Arthrospore. Arthrospore is basically rectangle in shape. You can see, if you see deeper, you can see it is looking like a rectangle like this. So that is called arthrospore, barrel shaped you call. Orthospore or barrel shaped. They have same meaning. And last one is this is a crushed ping pong. Always asked, many times repeated. This looks like a crushed ping pong ball. Okay, ping pong ball. This black color ones. Okay, they are the cysts actually. Okay, type of cysts. Now, when I talk about the broomstick or whatever, I always told in our South actor Talai, Ajit Talai. So I told Talai is using broomstick to help his wife cleaning the house, or is doing painting with a brush. So that is Thalaromyces. Thalaromyces. When I talk about Thalaromyces, this is the new name for penicillium. Nowadays, we don't call penicillium much. We call it as Thalaromyces only. Mostly we call Thalaromyces. Okay. Tuberculate means it's if TB-like. TB-like one fungi which is dimorphic, which causing TB-like means that is your histoplasma. histoplasma. Okay, histoplasmosis. Arthrospore. Arthrospore, I told the cock, one of the cock's name is called arthrodimorphic. Cock, I told. So it is coccidiosis. Coccidiomyces or coccidiomycosis, whatever. Coccidiosis. Okay. Crushed ping pong means, if you know ping pong, PP, that is crushed PC is there. So pneumocystis carni. Pneumocystis carni. PC. Okay, ping pong appearance. Now you have to match the thing. Directly everything is done. So first one we told, it's thalai, we told, so thalaromyces. Tuberculate, which is looking like a TB, which is a histoplasma. Arthrospore, coccidiomyces. Pneumocystis carni, ping pong appearance. That's all. Very simple, you know. Without option only, you can tell it. Okay. So A is 2, A is 2, B is 4, 3. Right. First option. Okay. D is 2. Wait, something. Sorry. A is 4. Once again, sorry. Option mistake here. First one. A is 2. Yeah, sorry. This is second option actually. Oh. A is 2. B is 4, C is 1, and D is 3. Right. Okay. Easy. So you already marked, no problem. Even if that is also gone. Next one, another again. Again, this is all this picture I've drawn because definitely you're going to have one or two questions from this one. Okay, for surely. So look at this one. In this picture, I'm seeing if you elongate, see, I'm seeing very tiny, like this, tiny budding yeast cells. Okay, tiny intracellular, tiny budding yeast cells. I'm seeing. I'm going to write here intracellular. This is narrow. You see the budding is narrow. Okay, narrow budding, intracellular, narrow budding yeast cells, BYC, I'm seeing. Okay, here I'm seeing 8, number 8, figure of 8, which is, you call it as figure of 8 or broad-based. We call this broad-based budding cell, broad-based budding yeast cells. Okay, budding yeast cells. Okay. This one, I'm seeing just spherules. I'm seeing the spherules with spores inside. Spores inside. Okay, spherule with spores. Last one, what I'm seeing, cartwheel appearance. I'm seeing a cartwheel appearance or ship wheel, whatever it is, ship wheel, cartwheel, all are same only. Sometimes Mickey Mouse also. If it is only one, fewer left, we call it as Mickey Mouse. This is characteristically, you know, when you see very narrow angle intracellular, it is your histoplasma. Broad, everything is B here. So everything is B means, so it becomes very easy for you. B for blastomyces. So 2 is blastomyces. Spherules with spore inside, characteristic for your, which one? Coccidiosis. If this one, if they give rhinosporiosis also, it's correct. Rhinosporiosis also have same like this. Almost similar to the spherules with spores you see. Okay, spherules with the spores in the yeast form. Right. Okay. Now next is your last one is this cartwheel. We call it as a parawheel, whatever. Okay. So all these things are paracoccidiosis. Paracoccidiosis. Okay. You know that one means. So these are the things important. So you go and you know the picture and you have to remember it. Very important. So A goes to 4, B is 3, B is 3. Yeah, B is 4. Sorry, B is, okay, one second. A is 4. B is 3. Right. Okay. B is 3. Right. C2 and D1. Okay, good. Okay. So easy. So these are the things, okay, expected questions. You can have questions like that also. Anyway, it comes. Okay. Now match the following. Okay. So this is nowadays they're asking directly single standard, double standard. I think now in latest FMG also one question came. I think RS, respiratory sensitive virus, a single strand RNA. Some students were saying. So you can you have to be a little bit ready with that also. So easy to remember is, you know, remember the DNA virus. DNA virus means happy, right? DNA virus is happy virus. HAPPY. H for, you know, herpes. Herpes, other H is for hepatitis B virus. A for adeno. And P for parvo. P for papilloma. Other P is for pox. That's it. Okay. These are the important things. Now, you should know that everything, all the DNA viruses are already, all the DNA viruses are single stranded DNA. All are all are double stranded. All are double stranded. RNA viruses are usually single stranded RNA viruses. Okay, when you talk about DNA virus, RNA virus, double stranded. But we have exception. First, in DNA, the except. There are two exceptions here. When you talk about the exception for DNA is your parvo. Parvo, we always say parvo is single parvo. So it's a single stranded DNA virus. And RNA, it is basically rota. Rota, Rio. I mean, under Rio comes the rota. I always say this Rio birds, that parrot bird, the Rio bird is a movie also Rio. They're always double. They don't be, they're lovebirds. They're always together. Okay, double. So double stranded RNA virus. Okay, this is the difference. Rest all are fixed. Okay, most of them are this category only. Okay, and you should know the DNA virus. So now let's go here. Single stranded RNA. So that is common one. It could be any RNA virus. So I'm going with 4. COVID is RNA virus, single strand, nothing special there. So double stranded RNA. What about double stranded RNA? Double stranded is your rotavirus. That is Rio virus. Under Rio comes the rota. Okay. Okay. Under Rio, the next one is your rota. So the same thing. Colorado also one exception, but usually they don't ask. So it's okay. Okay. Now single stranded DNA. Single stranded DNA or the normal single stranded DNA is your parvo. Whereas double stranded, when it is a double stranded, single stranded is parvo. Yes, double stranded is your normal HPV virus. Okay. So A goes to 4, B goes to 2, yes, and C 3, C is 3, and then, okay, fine. Okay, D1. Right, this is the option. Okay, very easy. So you have to know happy virus, and please don't forget the exceptions. Okay, parvo and rota are the exceptions. Okay, one category definitely asked question. One thing will be there for sure. Next, appearance. Look at the appearance of the viruses. And talk about the appearance of the virus. Also, don't forget in virus category the naked ones. Okay, for the clue for the naked DNA virus and the naked RNA virus. So this you have to know. They might ask. Not it's like expected question only. It's not a rare question. So give me 1 second. Okay. So naked virus. Naked, always you have to do pap smear to do a naked. The woman should go naked to do a pap smear. Okay. So now P for parvo, papilloma. See, both the cases, Papa is coming, A is coming, okay? Adeno. That means pox virus is not there, okay? Remember, okay? Naked RNA, you do PCR nakedly, okay? Some people do PCR naked, remember like that. So for that, remember, first is pick or no. Pick or no, for taking pics, you go naked. R for, I remember, I told you, Kali, Kali, the fighter, the WWF fighter Indian guy, he is always naked, calcivirus. R for the Rio bird is always naked. Rio, that is Rio. If Rio comes, is always rota. They are same. Okay. Remember, this is very important. PAP and PAPS, you should remember. Anything can be asked from this one. Okay. Classification of it's very important. And of course, the viruses shapes you know very, very well. So rotavirus, you know that rota means rotate. Rotate with the cart. Okay. Rotate with the cart. So cartwheel. Adeno, I told Adnan Swami. Here I'm going to write rotate the cart, rotate the wheel. Okay, rotate the wheel. Rota, rotate the wheel. Okay, Adnan Swami, the rich guy, I told he's having a space vehicle. He himself has a space vehicle because very popular rich guy. So he's having a space vehicle. And so rabies is bullet. I always say when there is a rabies dog, very dangerous rabies dog, what they do, some people they take the bullet and kill it. Okay, when the rabies dog is there, they take the bullet and they kill it. Okay, rabies dog. Okay, bullet. E filamentous. After E comes the F. Alphabetically after E comes the F. So Ebola, this thing. Okay, very very simple. Okay, this all should be in your fingertips. Tup, tup, tup. It should go like that. Okay, so A is 2, B is 3, and C is 1, and fine. Okay, we already know it. Okay, so this is a cue. You can see it looks like a bullet. So I'm going with a rabies bullet. Okay, and I'm looking this is like a box. See, it's like a box or a brick. Okay, it's like a brick with the dumbbell inside, dumbbell DNA. Okay, brick with dumbbell. So brick with dumbbell or box, which looks like a box. Then I'm going with the pox. It looks like a box, so I'm going with the pox. Okay, pox virus. Okay. You see space vehicle. Space vehicle, who is having a space vehicle? Space vehicle is owned by our adenovirus. Okay. And here I'm saying this is a cartwheel. Okay. It's like a cartwheel. So what you do, you rotate the cartwheel, rotavirus. Okay. Here it's filamentous. So it is because it's filamentous, alphabetically after E comes the F. So Ebola. Okay. Right. Ebola. Very, very simple. Very easy and very statistically, you can have one question. This picture, I always expect this picture. Virus and TB bacteria, you know it very, very well. Okay, we can write it also, nothing wrong in it. So you know that the most important things are, okay, it's already given here, fine. Look at this, a 8-year-old boy, here says that 8-year-old boy presents to the pediatrician with, today history of fever and headache is there. Okay, fever and headache is there. The patient is unable to touch his chin. The patient is unable to touch his chin. That is typical meningitis, right? Okay, now doing a lumbar puncture was done and CSF has been sent. Before that, before beginning the empiric treatment, CSF is sent for analysis and culture. This is important. The patient condition improves over next week. So if any meningitis that improves over next week means itself, and then you see next point. In meantime, bacterial fungal cultures are negative. Okay, but this point is important. So the diagnosis is meningitis. But because before 1 week only, the patient, they say that with next week if he improved, that means it's viral. Only viral meningitis, the thing is very, very good. Okay, so viral meningitis, when you talk about generally about viral meningitis, the most common cause would be, first of all, enterovirus, then followed by herpes simplex virus 1, 2, whatever. 1 is very common. Then mumps, measles, they can also cause other person. Okay, fine. Now then, which are the following most likely? So this is the viral meningitis. So in viral meningitis, you know, everything is normal. Only a cell will go high. Which cell? Lymphocytes. Exactly this one. B is your answer. Viral meningitis. Okay. Because the only cell goes, rest all maybe mild increase or mild decrease only. There is no proper increase or decrease. Main thing for you, lymphocyte should be there. That is the main thing. Okay. So this is your viral meningitis. What about the first one? Everything is normal, only neutrophil is increased. Could be bacteria, but there is no any proper this thing. But a typical bacteria, what should have? Your CSF pressure should go high. Protein also will go high, decreased, and neutrophils are rise. That is bacteria. That is bacterial meningitis. Okay, could be E. coli or Streptococcus pneumoniae, which is most common one, or H. influenzae, whatever. Again, same picture, increased, decreased. Glucose is going down, but of course, see, in any bacteria, glucose is going down. Bacteria is eating the glucose, so it will go down. Inflammation is caused, so all the protein matters will come out. So protein automatically has to rise in the blood. Okay, that's acute phase reactant proteins, right? So lymphocyte is high. So when this lymphocyte picture comes, it's TB or fungal. It should be usually it's TB fungal. Okay, so this is the clue. So we are going with viral here. That's all. Very simple. So no mistake. This should be clear. In viral, everything normal. Only lymphocyte goes high. In bacteria and TB, only difference is lymphocyte and neutrophils. That's all. Okay. Right. Next. Look at this picture. A 30-year-old sexually active woman presents with a painful vesicle in the external genitalia and bilateral inguinal lymph node. The painful vesicle is one clue is more than enough to say that vesicle is given. So it just definitely goes with herpes simplex virus 2. Okay, 2. And then Sang-smear from the vesicle showed the following image. So you're seeing what you're seeing. You're seeing a multinucleated. This is a Sang-smear. Sang-smear is basically you're taking from the deep tissue. You remove the vesicle up, and from the lower base, you are scrapping and taking and making the smear. Okay. So Sang-smear, you're seeing what? Multinucleated giant cell, MNGC cell. You call multinucleated giant cell. So that means this is more likely HSV2. So HSV2 means the treatment would be, of course, acyclovir. HSV1 or 2 doesn't matter. Treatment is acyclovir. Of course, for the herpes zoster also. So treatment of choice is acyclovir. That's all. Okay. Simple question. But yes, please don't forget MNGC and painful vesicle. Painful vesicle next to gentilum is HSV2 only. We have Ducrey also painful ulcer, but that's not vesicle. Okay. That'll be ulcer, not vesicle. Okay, that's all. Okay, so this is easy question. Easily not make mistake. Okay, so when you talk about Sang-smear, you think about HSV1, HSV2, also varicella zoster virus, chickenpox virus. Okay, that's it. This is important part. Okay, next one. This again, yeah, this also can have this time been a while. They didn't ask, but expected question only. A 66-year-old man present to clinic with painful rash. He states he started on the left-sided rib chest pain. See here, left-sided he has this one. The burning sensation is there. The pain, burning sensation, this lesion is here. It's very tender when he touches. It's very difficult to even wear cloth. That's what patient will say. It is reluctant to wear the clothing also, that much painful. So left side, so they saw this erythematous papular vesicular rash in the dermatome distribution. So these are the dermatome distribution. Dermatome is along the dermatome, along the ribs, the dermatome. You see only that, and it's unilateral. Unilateral along dermatomes. Severe pain plus, very much pain will be there means, and of course the vesicular lesion. Usually it will be vesicle, and then it becomes the crust things all form after that. Okay, right. Now look at this. So this unilateral things comes, you have to think about what? Shingles. Shingles in adults, that is reactivation of chickenpox. So shingles, usually this picture, unilateral pain, everything will be there initially. Okay. Erythema, what about erythema infection? That is parvovirus. Parvovirus, totally different picture. Slap cheek appearance, different picture. Primary herpes, no. Primary herpes simplex, primary herpes, no. There also would be only vesicle, but not this picture. Either it's upper or lower. Totally different picture. We don't have this. Chickenpox. Chickenpox, on the other hand, see, this is the reactivation of chickenpox. This is the reactivation of your herpes zoster virus. This is a primary herpes zoster virus infection in children. So here it is bilateral pleomorphic, not that painful. Okay, pleomorphic lesion means multiple variety of lesions you can see, and it's bilateral. That is totally different. And centripetal, it starts from the trunk, goes to the periphery. So that is not here. Here only single side, this thing. So shingle means single side. Single side, okay, single side rash with severe pain is there, then you give it. Of course, you're going to give the treatment. You're going to give what? For treatment, you're going to give GABA for pain, especially this is called post-herpetic neuralgia. Post-herpetic neuralgia. You have to give acyclovir. With that, for the pain, gabapentin. Okay, gabapentin or yes, mainly we give. I'm going to acyclovir. Yes, acyclovir also you can give. Okay, acyclovir, treat that one. This is for gabapentin. Okay, fine. This is another very important one. Okay. What we left here. Yes, so shingles we finished. This is parvovirus, herpes, totally different, and this thing. Okay, so remember, one question will always come from this. Okay. One more thing also, gabapentin and pregabalin. I forgot pregabalin. Yeah, pregabalin also painkiller you can give. Okay, with that acyclovir as well. Okay, that's all. Right. Next, inclusion body is given. Which are the following is correct? So what I'm seeing an owl eye. I'm seeing an owl eye inclusion body. When I see an owl eye inclusion body, I always think of the chief ministers. Chief minister's house, they always have this owl in their house. Okay, they have the owl. This is one thing. Okay, remember, main thing that's important. Rest we'll see. Now, it causes mononucleosis? Definitely yes. So when owl comes, you think about cytomegalovirus. Cytomegalo causes mononucleosis? Yes, they have told incorrect statement. Yes. Paul Bundt is positive? That is wrong. The only difference for CMV and Epstein-Barr virus, both of them are causing infectious mononucleosis. That is basically sore throat. They cause severe sore throat with all the sore throat, lymph node enlargement, so many things will be there, and with also they have atypical lymphocytosis. Atypical lymphocytosis will be there in both. Only thing is that the test is Powell-Bunnell and monospot test. It's a heterophile test. These two tests will be positive for Epstein-Barr virus. It will be negative for your CMV. That's all. Apart from that, other things, EBV causes a lot of cancers and all. His CMV doesn't cause cancer. It causes congenital infection, calcification, microcephaly, those symptoms, chorioretinitis. So that's the thing. Okay. So now it causes retinitis and HIV. Definitely yes. It causes HIV retinitis. Cerebral calcification fetus. Definitely yes. So this usually causes which one? Periventricular, VCMV, ventricular, periventricular calcification, and also child will have microcephaly. Usually child have microcephaly and periventricular. It's a characteristic feature. So this is wrong. Powell-Bunnell monospot test should be negative CMV, which is positive in your EBV. That's all. Okay. So this is another important question. As per this question again. Yes, next question. By seeing this picture without going anything, I'm seeing only what I'm seeing. Again, I'm seeing something called what? Starry sky. Here also I'm seeing starry on staining. I'm seeing a starry sky appearance. Whenever I see a starry sky appearance, here I'm automatically going to think about what? I'm going to think about the Burkitt's lymphoma. This is a lot of lymphocytes rise. So Burkitt's lymphoma. 8 to 14 chromosome transaction defect. You know that. I'm going to talk about it. So Burkitt's lymphoma, most of lymphoma is caused by which one? Epstein-Barr virus. Okay, this is all our lymphocytes you're seeing. And then in between the lymphocytes, you see single macrophages. Okay, macrophages, one thing. That is only basically gives the star-like appearance. Okay, right. Now, you see a 10-year-old boy with a swelling on his face. There is a swelling. There is swelling in his face, progressively increasing in the size. Okay, some swelling. That is, you should catch us for Burkitt's. We know that. He's immigrant from Africa. Africa is very common here. Mild pallor and large swelling around the right maxilla. Exactly. Okay. And then biopsy taken showed a starry sky pattern. Starry sky is enough to say it's Burkitt's lymphoma. So here the causative agent is, of course, your Epstein-Barr virus. Epstein-Barr virus. Epstein-Barr virus not only causes, it causes Hodgkin's, also Hodgkin, non-Hodgkin. Hodgkin, non-Hodgkin only. We are talking about Burkitt's. Okay, non-Hodgkin lymphoma, and it causes the nasopharyngeal carcinoma, nasopharyngeal carcinoma. Also, it causes the gastric carcinoma also. The most common cancer for Epstein-Barr is gastric carcinoma only. And also it causes oral leukoplakia. Okay, these are the common thing caused by Epstein-Barr virus. Of course, the main disease is infectious mononucleosis or kissing disease, which is also caused by CMV virus, okay, or kissing disease. That's all. Okay. And you know that the cell affected in Epstein-Barr is B cell. B lymphocytes. B lymphocytes main reason, especially we're talking about CD21. This is another important. Okay. And the two tests, you know, Paul Banel and the monospot, both are very characteristic tests. That is the heterophile agglutination test. Okay. That's all. Very, very simple. This much only for revision you need. Yeah. More than enough. Look at this. Here also I'm seeing this picture. When I see this picture itself, I'm thinking slapped cheek. Someone has slapped this kid. Okay, someone has slapped this. Who definitely it should be our Choti Paru, the angry Paru, the single Paru who's frustrated in her life, right? So automatically I got the clue. So now here you 3-year-old child brought to clinic with the erythematous rash on the cheek. Okay, cheek. Then to splinter, whatever. Mainly it's cheek. Then a low-grade fever, headache, mild upper respiratory infection. Not that important, but it contains the suspected organism contains single-stranded RNA. That's what. That is more than enough. Okay, if single-stranded, so only single-stranded RNA is our Paru. So here you can see here the picture. This is our single small Paru, smallest virus, single stranded DNA, small Paru. Okay, Paru. Paru, I'm talking about parvovirus. So what is she's always frustrated? So what happened? With her 5 fingers, she slaps the child. She slaps the child. Okay, so this is slap cheek appearance. The idea is slapped cheek appearance, or we call it as 5th day disease. 5, no? So 5th day disease. 5th day disease. All are same. Okay. Or the slap cheek appearance is otherwise also called as erythema infectiosum. Erythema infectiosum. Okay. Erythema infectiosum. Very important. Okay. And we already spoke about this. So 5 finger slap cheek, 5th day disease. And we call small because it's only single stranded DNA virus. Okay. Smallest virus. And this is the smallest virus we have. Smallest, that's what we call Choti Paru, single and small because it's a small thing. Okay, this is a Paru in the Devdas movie, Aishwarya Rai's role. Okay, you know that one. In children especially, sickle cell anemia. Children with sickle cell anemia, okay, it causes aplastic crisis. It causes the aplastic crisis. Aplastic crisis. But in adult, it causes pure red cell aplasia. Pure red cell aplasia. Pure red cell aplasia. Okay, this crisis, C for C children crisis, adult pure red cell aplasia. In newborn, it causes the non-immune hydrophytalis. Non-immune hydrophytalis. Not the regular hydrophytalis. Regular hydrophytalis is caused by, RH incompatibility. Here we're talking about immune hydrophytalis is RH incompatibility. Here we're talking about non-immune. Non-immune means you always think about the parvo. Okay, right, then. So this much only. This is for your thing. And of course, main thing, if we talk about which antigen is affected, parvo. So it affects the P antigen of RBC. It's the main target. P antigen of RBC. That's what you see everywhere. Red cell, aplastic, hydrophytalis, everything is coming because of that only. RBC's favorite site. Okay, RBC, P antigen of RBC, its favorite site. Don't forget. Okay, that's all. Next question, if you see here, see the question. We are in virology now. Okay, we are mostly in virology here now. So here, a 21-year-old woman present with a sexual health clinic with multiple painless lesion. This is the lesion. Okay, this is the lesion over vulva and perianal area. They were skin colored, mostly smooth papules, less than 5 mm, but few raised cauliflower-shaped clusters. This is the one, cauliflower-shaped clusters. Which human papilloma is most likely? Yes, very, very simple. You know, this is a direct question. So this is basically what you're seeing here is a condyloma acuminata. Condyloma acuminata. Condyloma acuminata plus laryngeal papilloma. These two conditions are caused by which HPV? Your HPV, you know that it is basically HPV 6 and 11. 6 and 11 is the common one. Whereas 16 and 18, they cause cervical cancer. This was answer. Cervical cancer. Okay, cervical cancer also not only cervical, it can cause vaginal, anal, even oropharyngeal. This question was asked in our now recent FMGE cancer. Okay, so vaginal cancer, anal cancer, oropharyngeal carcinoma, all right. Even anal, yes, everything is penile cancer also. Because all anything related with the sexual activity that cause cancer can come. Okay, that's also here. Of course, your answer is HPV 6 and 11 is also correct. It causes allergic papilloma, condyloma acuminata. Both can be asked. This is basically warts. Condyloma acuminata is warts. Okay, that's all very, very simple. Next one. HPV protein. When we talk about HPV protein, you know that we have E1, E2. Then what else we have? We have I'm going to write it as E6, E7. Okay. Basically, I'm going to write this is not a E1. I'm going to write it as L1. Okay. I'm going to write it here L1. L1. Okay. Fine. So, and E5 also is there. Okay. Fine. L1 is basically needed for making the, what you make, the L1 is needed for making the vaccine. E2 not much significant. E5 forms something called coilocytes. Atypical cell. It's a atypical cell in a cancer, no? Atypia we call coilocytes. 6 and 7 is very important role for cancer. Why? Because P6 inhibits, E6 inhibits the P53. Whereas 7 inhibits the, which one? Retinoblastoma. So because of this two anti-cancer inhibited, there is increased risk of cancer. That is cervical cancer. Cervix cancer. Okay. So E6-7 has important role in cancer. E5 also, but that is more atypical, early stage coilocyte, and L1 for making the vaccine. So these are some important vaccines, you know, Gardasil and Cervarix. Okay. That's more a gynae question. Okay. Fine. That's all. Next. Look at this question. Now, yeah, hepatitis B, based on this, they'll ask you one question. They'll give you the idea and then tell to find it's acute or chronic hepatitis. High replicational role, severity is more or less acute or chronic like that. Okay. So now here we know very, very well. First of all, one clue only to say that. I always say that whenever you talk about HBsAg, and of course it's antibody, HBsAg and anti-HBs, okay, antibody. Other one is you have the HBe antigen, or it is antibody, anti-HBe antibody, right? And the last one is your for core antigen is useless. So we usually talk about the anti-HBc IgM or anti-HBc IgG. The core is useless. Antigen is useless. Okay, this is fine. So now when you talk about HBs antigen, yes or no? Infection is yes. Yes means yes. Yes means yes. Anti-HBs means there is no infection. No infection. Yes or no. Infection is there or not. That's it. That's what we say. Okay. Or maybe vaccinated, whatever. Whenever E means I told everything is dangerous. Everything dangerous. E for enemy. E for enemy. When you talk about enemy, I always say replication, infectivity, severity. Everything is high, high, high. If antibody is already formed, everything is low, low, low. All these things are low. Shortly. IgM is there, always acute. G is there, always chronic. That's all. Okay. Look at the first condition. Look at the first condition. First condition, you can see HBs is positive. Infection is there. IgM is there. IgM means, so I'm going with acute hepatitis. with HBe antigen. So infectivity is very high infectivity. Okay, antigen, no, so it's still infectivity is high. So acute hepatitis with high infectivity. So 2. A is 2. Okay, I think most is option C. Okay, A is 2. Next one is B. HBsAg infection is there. IgG is there. So it's chronic. So chronic hepatitis with what? Chronic hepatitis with again HBe antigen is there. So high infectivity. So your option is this one. So first one is this. This also done. Okay. Now HBs is there, means definitely infection is there. G, yes, chronicity also is there. Chronic, it's a chronic hepatitis. But HBe antibody is already formed. That means the severity is low. Right? I told you when antibody to E is enemy, everything is antigen means everything is evil. E antigen, everything is bad. But antibody to E is formed means everything goes down. So low infectivity. So this is for C is 4. Good. Finally, anti-HBs. Anti-HBs means I told no infection. That means patient is recovered, already recovered. Okay. So with anti-HBC, so he had previous infection, now he is recovered. Okay. With rest, all doesn't matter. Okay. So that's enough to say recovered person. So your answer is C. Very, very simple. So no mistakes in this question. You shouldn't make. Okay. It will be totally wrong if you make a mistake. Okay. Now, feeling fatigue. Look at this question. Huh. Feeling fatigue, a man visits the doctor on physical examination. On physical examination, you can see that patient has reduced liver size is reduced. So more, it's like a cirrhosis. It looks like a cirrhosis symptom. After thorough history, doctor learns the patient had jaundice. Okay, jaundice 5 years. Following a okay, patient had jaundice 5 years ago following a car accident. So something happened, hospitalized, blood transfusion. That's it. Blood transfusion means itself the most common virus with during blood transfusion is hepatitis C virus first. Followed by that only hepatitis B virus. Okay, always C virus. So first one cirrhosis we got a clue. Cirrhosis we got, and then hepatitis C B clue has got. We have got this clue. Now here you can see doctors not surprised to elevated ALT. ALT is raised. Okay, ALT elevate. Of course, liver is gone, so everything goes high. And he awaits an ELISA to differentiate the cause of this illness, which is the most common virus that we told. So it's directly when you talk about this cirrhosis, HCV. That is cirrhosis and carcinoma. Cirrhosis and carcinoma or chronic hepatitis. Anything with C, most common is your hepatitis C virus. Okay, though incidence is less, but most common HCV only. Okay, more than your hepatitis B. Another reason is there is no vaccine for C virus. B, we got vaccine. C, no. So automatically it goes to this. So hepatitis C virus. That's it. Okay. And E is or fecal route. So E usually causes only acute hepatitis or fulminant hepatitis in pregnancy. Only in pregnancy. Fulminant hepatitis in pregnancy. Pregnancy it causes fulminant pregnancy. Okay, that's it. Hepatitis B virus, you know. BK is usually K for K, kidney transplant. Usually this occurs, BK virus is usually in the kidney transplant patient, kidneys affected. That's it. Okay, that's it. Nothing much there. Show it. Next. False regarding HIV status. HIV status is one very, very important question they always ask. HIV status. So before going to the HIV stature, yes, we'll talk about the genes, important genes. We talk about the HIV genes, structural genes. First is the envelope gene, envelope gene, then pole gene, gag gene. They all represent some important structures. Envelope is always the outer covering. No, it is the outer covering. So outer covering you see G20, 41 is there. So they are the one which represent the group 120 and then group 41. Okay. And 160 also sometimes. So 160 also. But here you 41 and 120 is very important. Pool, always I told you, remember, pool of enzymes. Pool of enzymes. And what are the enzymes? Whenever someone get HIV, patient will be RIP, RIP. So that is reverse transcriptase, integrase, and polymerase. Integrase and polymerase. These are common enzymes. GAG gene, always I told Lady Gaga, she always say her age is 17 to 24. Always she says this lie. Okay. So 17 to 24 is the most, that's a GAG gene. That's all. This is the important thing you should know. And you know 24 is very important for diagnostic purpose also. Yes. Now we'll go to the next one. Normal CD count, you need to always have to be 500 to 1500 is the normal count. So now when it's less than 500, less than 200 and less than 50, what are the diseases? You know, always they give in a question, one clue will be there. Less than 500, you always think about TB, you think about Candida, you think about Kaposi, chances are high, or patient can get herpes zoster. That's all. Very common. TB, Candida, Kaposi, herpes zoster. Very, very common with the less than 500 category. Less than 200 category, yes, important. Toxoplasma, Cryptococcus, Cryptosporidium also, but Cryptococcus main, and Pneumocystis. Pneumocystis. This is 100 or less than 100. Both are fine. Both, it is fixed in both the category. Okay. Toxoplasma, Crypto, Pneumocystis. Less than 50, two important things, very important things. One is your cytomegalovirus. Other one is your, which one? MAC complex, TB. The TB Mycobacterium avium intracellulare complex, MAC complex. So less than 50. So this is one thing you have to remember. And we know that for screening, diagnosis part, screening test and additional test, and then the confirmatory test. Three important tests we have. And for prognosis also, which one we are using? Confirmatory prognosis. Screening, of course, always you do ELISA or CAR test, rapid CAR test, or you know the TRIDOT. TRIDOT will be, it has three dots. We can distinguish HIV 1 and 2 also, right? That one, TRIDOT. And comb test. Comb is not the comb test. This is this normal, our comb. It looks like a comb. So many people, patients can be treated at same time. Okay, CAR test, TRIDOT, and Coombs test. Additional test, Western blot. Western blot is not anymore confirmatory. We still be doing, but then most confirmatory means PCR, RT-PCR. And then another one is P24. Also, you can do P24 antigen. So RT-PCR earliest to become positive within 12 means you need at 12th day. At 12th day after intercourse, 12th day they can get positive. P24 takes 16 days, at least 16 days to become positive. So after sex, if someone want to check it earlier, then the best is PCR only, 12th day. Okay. And P24 takes time. It will take some time. So wait. Okay. Prognosis, of course. Prognosis, if you want after treatment, to know the treatment prognosis, PCR is the best, not the CD4 count. PCR is better than the CD4 count. Okay. PCR is now the most better. Okay. It's the number of copies decreased or not, accordingly treatment would be done. Okay. This is for the, now let's go to the question. Now, reverse transcriptase, false, okay, which is the false statement they asked, okay. Reverse transcriptase synthesize the double-strand DNA from genomic? Yes, definitely. That's the main reason for the reverse transcriptase there, okay. One. Two molecules RNA, definitely this is very unique. Only HIV has this type of thing. Everybody in RNA virus, only HIV has two RNA molecule. Two single-stranded RNA molecule it has. Rest all only, other virus only one, okay. Then P24, group 24 is attachment, yes, and 41 for fusion, yes, they are the main function. 20 and this main function, this only for attachment only, and fusion enzyme. What about the gag gene synthesis? No, this is wrong. This is another very important question. This is wrong. This is the answer because this is not the gag gene. I told pool of enzymes. So pool gene. Pool gene is the one that is the transcriptase. So these are important. Why? Because the drug manufacturing, all the drugs based on targeting these genes and enzymes only. So that's what it's important. Okay, so pool gene, pool of enzymes. Okay. That is, I told pool gene for reverse transcriptase, integrase, and polymerases. Okay, that's all. Protease also, once again, polymerase, but also protease is also important. Okay, this RIP, P stands for protease, also polymerase and protease. Okay, all are important here. Okay, fine. Okay, next. A mother brings her, this is another very interesting question, 3-year-old child, vomiting diarrhea past 2 weeks. So childhood diarrhea. Childhood diarrhea, of the first thing you have to come in your mind is childhood diarrhea is rotavirus. Okay, fine. Now, diarrhea is watery, and although mother denies any blood in it, so it's not dysentery, it's plain diarrhea, and the doctor makes diagnosis by ELISA on the stool. Okay, the coproantigen. In stool, they say it is basically coproantigen. It is basically antigen or antibody, whatever it is. They did some ELISA on the child's stool. Assure mother will be fine with good rehydration, and assures the mother that he will be fine with good rehydration. That's it. So basically here they are talking, when this type of thing comes, it is very much close to rotavirus. That's all. Okay, very simple. Rotavirus only causing this typical chest thing. Norwalk is same, but in adult. Adult, most common cause of viral diarrhea. Usually in the cruise ship. In the cruise ship, you get this diarrhea. And Shigella, it causes bloody dysentery. That means there should be, blood will be there and other different things. Giardia causes steatorrhea. Foul smelling. Sorry, we already spoke about it. Okay, so rotavirus. So this is very important. Yes, one important thing is that rotavirus and rotaviruses vaccine you should know. For one thing is rotavirus, rota means the shape we already spoke, or it's, first of all, it's a double standard RNA because it comes under Rio. Second one, it is, it is the cartwheel appearance. It has cartwheel appearance. Cartwheel appearance. Okay. Now, Rotarix, two things are the vaccine. Remember, Rotarix, remember, is a Ricky Martin. Okay, Ricky Martin. Ricky Martin, you remember. Both common thing, first of all, both are oral live vaccine. Oral live vaccine. That's the main thing. Okay. And they both are like less intersusception. They can, but into susception, less into susception seen nowadays because these were very popular. Then don't not when. Okay. So Rotarix Ricky Martin. Ricky Martin was initially he was married to a man. Yes, again. So 2 doses. Usually give only 2 doses. That is your second and second. That is your second month and the fourth month. That's all. Okay, 2 doses. Rotavac, we give with the other vaccine. Okay, so 6, 10, 14th week, along with DPT, OPV, we are giving 3 doses. We are giving. Okay, 3 doses. This is single vial. One single vial, you finish it. So no any wastage. But here, multiple vials. We have multiple vial. Okay, there is no single vial. Multiple means like one thing you use for many patients. So a lot of wastages can happen. Okay. That's it. So these are the things. So always remember this vaccines, we have to give within 8 months, not more than that, within 8 months. Because after that, increased risk of intersusception. Intersusception. Okay, that is the main reason. So always remember within 8 months important. Rotarix is 2 dose single vial. Here it is 6, 10, 14 multiple vial is that. That's it. These are some important few points. They can ask about the vaccine rotavirus, but both are oral live vaccines. Okay, very simple. Most common cause of childhood diarrhea. Okay, now a patient complaint of you can see here a fever, rash, retroorbital pain with history of dengue hemorrhagic fever. Okay, so they already given retroorbital pain and hemorrhage is there, means that's most likely dengue only. So what is the best test to diagnose? Which is the best test to diagnose? So you know that very, very well. So before going to, yes, we can go here, no problem. First of all, causative agent. So dengue virus, you know that is dengue. We have 1, 2, 3, 4, 5, right? 5 vectors are there. Vector, Aedes. Aedes or tiger mosquito, very important. Tiger mosquito. Yes. AD is one compound, that is antibody dependent enhancement. Very characteristic for dengue enhancement. What happened when this usually the type 1 affects first? When type 1 virus affects first, our body produces non-neutralizing antibody. So this non-neutralizing antibody, what happened? Instead of decreasing non-neutralizing antibody, what happened? No, antibodies formed. Then what happened? Type 2 virus is attacking. After that, let's say type 2 virus is attacking our body. So that time what happened? It is instead of protecting, it is not protecting. It is increasing the infection. It's increasing the infection, which is one of the main reason to go what? We have dengue hemorrhagic fever. That's it. Okay, this is called antibody dependent enhancement. Okay, so this HV2 uses this non-neutralizing antibody and increase the infection instead of decreasing it. That's what we have hemorrhage. That's all. Okay, so diagnosis, one important diagnosis in dengue fever, that is your which cell platelet goes down. Platelets will decrease, thrombocytopenia less than 1 lakh means it is more of this thing only. That's what you do. What? The tourniquet test. Tourniquet test you do. In tourniquet, how many rashes should be there? More than 20 per cubic mm it should be there. Rashes, okay? More than 20, this rash, these particular rashes, small rashes. So bleeding symptoms will be there. That's the reason. So basically now what happened? You can classify this within 1 week, what is the diagnosis, and more than 1 week, and for months, if it is already months, just to see it's not significant. Within 1 week means best is NS1 antigen, or some book it's written 5 days. Okay, so NS1 antigen ELISA is the best one, but if it's more than 1 week, you depend on IgM ELISA. For long months and all, IgG, not that important. It's only for to know the patient had history of this dengue or not. So here they have said the best is to diagnose more than 1 week. Yes, so it's more than 1 week. So it is IgM. If it's less than 1 week, NS1. More than 1 week, then if you go to IgM capture ELISA. That's all. Okay, very, very important. So that's one thing you got it. Okay, easy. Next question. By seeing the question, don't get big question thing, because sometimes the big questions are only the easiest ones. Okay, so remember that. Fine. Now, influenza virus type A. Look at this question. Influenza virus type A, usually mild self-limited febrile illness. However, worldwide epidemics, pandemics have occurred at different times of time due to rapid changes in the genetic makeup. Which are the following is most important reason for this worldwide epidemic? So that is very important. So in expected question, always they ask. So when you see a shift car, you have to remember two things. Okay. I put it a shift car because I want to write on this side antigenic shift. And another side I'm going to write antigenic drift. Drift and shift. Okay. Shift car, always class A. That means only influenza A is causing here, both A and B. A shift car, every 10 to 20 years, it undergoes genetic modification or genetic reassortment. Because of that only, it's world popular. World popular car. Everywhere you go, you see shift. Maruti Shift is the only car, Indian car available everywhere, you can say. Okay. I mean to say pandemics and epidemics. Drift, on the other hand, this is genetic reassortment. Here it is simply a point mutation, point of frame shift mutation. Mutation is the main reason. So it just causes mild epidemics. That's all. Mild epidemics. That's it. This is the clue. You got it. So now you already got the clue. So when I'm talking about rapid change, this is genetic reassortment. Genetic reassortment. And it causes worldwide popular shift. So it is shift car. Shift car is the one genetic reassortment and genetic. That is shift, here shift. Remember like this. So you will not forget it. Okay. Rest all are wrong reasons. Rest all the drift is for minor things. And these are the normal functions of hemagglutinin neuron. There's no link with this. Okay. Fine. That's what if you want to measure. So hemagglutinin is basically A for A. This influenza virus has this influenza virus. It comes under orthomixo group. Orthomixo group. That means it's the only virus in orthomixo group. All the ortho guys, they get what? Flu. All the ortho guys have influenza. And plus, remember, they all have segmented six-pack body. Segmented, not six-pack. They have 8 packs also nowadays. Segmented 8 packs. Okay. All the ortho guys have flu. First important question. And they have segmented body 8. Okay. That's the thing. So they have two things, hemagglutinin for attachment. Neuraminidase is basically opposite. What happened? It is attachment to, there is a receptor called sialic acid receptor and enters the respiratory, it's in the respiratory epithelium and multiplies. And after that, when it comes out, to come out, it has another sialidase. This actually breaks the receptor. So now what happened? Virus comes out of the cell. After multiplication comes out, all the viruses will come out. So opposite. So this mechanism is called as elution. You call it as elution. They call it as elution. So elution is for influenza. Okay, that's all. Very simple. Opposite function. Hemagglutinin attachment, neuraminidase or sialidase is to break this receptor and the viruses comes out. That's all. Okay, very, very simple. So in influenza, these are the common ones expected. Okay, now next question. Another important question. Topic important. You can see here a 6-year-old boy present with 2 days history of cough, coryza congenita. 3 C's are there. Okay, and then he's also developed a rash starting behind the ear. Behind the ear. That is already gives you clue. You should always think what? Measles. Okay, you think about measles. Okay. On examination, you notice a erythematous maculopapular rash, okay, in the some area and palms are so spared. On oral examination, yes, this very 3 to m bluish lesion surrounded by an erythematous base. He is not up to date with immunization. Which virus exactly? So everything is going towards so this one, when you talk about this bluish lesion, you're talking about Koplik spot. That's enough. Koplik spot and this rash, whatever, and the rash starting behind the ear, it more goes towards the measles. Okay, so this is Koplik's part. What you're seeing here, these are the Koplik's part. Okay, Koplik's part. Now, what happened? Where is my measles option? Do I have measles option? No, I have what instead I have paramyxovirus. Okay, that's what's important. Now, when you talk about paramyxovirus, PARAMM. Okay, remember like this. Param. Okay, param nahi hai. Param nahi hai. Okay, param nahi hai. So you say param nahi hai. Okay, he's not there. So first P for, this P stands for para-influenza. Para-influenza virus number one. R for respiratory syncytial virus. Okay, and another M for measles and mumps. N for Nipah, the latest one which is causing problem. Okay, so measles comes here, not rubella is not here. Okay, remember rubella doesn't comes under this one. It's a toga viridae. Rubella doesn't come under paramyxovirus. Okay, that's another important one. You should make mistake in that part also. Okay, right now let's go. So this is the thing. So your answer is paramyxovirus. That's all. Toga is basically rubella, so that just doesn't have any link here. HTV6, you know that what it causes? It causes the exanthema subitum. Exanthema subitum, or they cause roseola. Roseola, S is there. Yes, yes, yes. So it's 6. Everything with 6. Okay. Roseola infantum. Exanthema subitum, roseola infantum. Okay. Varicella is chickenpox virus. So answer is paramyxo. Very easily we got it. Okay. So that's what. So already told you paramyxo group I've told. Orthomyxo is usually influenza. Here this is the param. The shortcut is PARAMM. Param nahi hai. Measles, yes. Measles, what happened? This is the 10th level. In 10th day, you have 3 C's. That's what we saw. Cough, conjunctivitis, coryza. Cough, conjunctivitis, and coryza. Right? Coryza. This is on 10th day. This is on 10 different days. Okay. And on 12th day, you have what? Koplik spot. And 14th day, that is the rash that starts behind the ear. Behind ear, okay, behind ear, and then it spreads everywhere. So these are the characteristic and the feature. Complications, if you know, usually measles, otitis media, giant cell pneumonia, lungs, it can go and cause giant cell pneumonia and otitis media, giant cell pneumonia. One more, this chronic, as a chronic long-lasting autoimmune, it causes an autoimmune. What it is causes? It causes the SSLE. SSP, subsclerosing panencephalitis. That's all. Very, very important. Okay. Here, IgG will be the diagnostic. You will be using IgG. This was a question asked. So that's all. Okay. These are things important. Diagnosis, if you see, the special cell, you see Warthin-Finn-Kidley cell. Warthin-Finn-Kidley cells. So it's a sort of multinucleated giant cells only. Okay. Warthin-Finn-Kidley cells you see in that biopsy structure. Otherwise, you can do ELISA, PCR, same thing, nothing specific here. Vaccine name is very important here. Usually many times repeated. You call what? Edmonston Jagrib. Garib people, okay, Garib people, Edmonston, MSC Edmonston, Jagrib. Garib, okay, Garib means poor people. So remember like that, poor. That's all, okay. Schwartz also, actually Schwartz not that much asked. Usually Schwartz. They ask Edmonston, Jagrib is frequent asked question. So this should be, yeah, fine, okay, no mistake. Right, okay. Yeah, that's it. Next question. Next question, another, yeah, lot of times repeated question. A child was born with a history of respiratory distress and noisy breathing. Radiologic examination is shown. Radiologic examination, they have given this sign. This is a steeple sign. Steeple sign. Steeple sign means I always told you, this Paramahamsa, para-influenza Paramahamsa, he sits in the crop. Okay, that picture. Basically, the steeple sign is in the croup, which is caused by para-influenza virus. Okay. So croup is basically acute laryngotracheobronchitis. So your answer is acute laryngotracheobronchitis caused by para-influenza virus. That's all. Very simple. Steeple sign. Where acute epiglottis H influenza, there you have a sign called thumb print. Okay, it looks like a thumbprint on X-ray. Okay, there. Here on X-ray, steeple sign means, or church sign, steeple sign, so many names. It is usually parainfluenza. This is another question. Okay, don't forget. You can get this question easily. Now, next question. Yes, here tricky, but you can answer. A 55-year-old man with substernal pain radiating back to check and arms. Usually we think about something related to the heart only. Patient is seated and leaning forward. Okay, so that means more again. It looks like a pericarditis, something, right? So the pain is less severe in this position. When it comes like this, no pain. It comes forward, no pain. Otherwise, there is a pain. Okay, now he recently recovered from a febrile illness. Some febrile illness was there. On physical examination, scratchy, leathery sound is here at the left sternal border. So that is very much all. And also you see there is a ST elevation, diffuse ST elevation. So this is more going towards your pericarditis. Pericarditis. Okay. Now, which is most likely? So when your word pericarditis comes, only one virus very characteristically known for that is your Coxsackie. Especially B. Coxsackie B. Pericarditis is Coxsackie B, which almost looks like a MI only, but then you know the diffuse ST, this is all pericarditis. So now Coxsackie B, they didn't give the virus names, they told to find the virus. Definitely, it's not a RNA, it's not a DNA, it doesn't come in happy group. So it is a RNA virus. Fine. RNA. Again, in RNA, it is there is one group, if you remember, and picornovirus we have picorno, P-I-C-R-O-N-E. Under picorno, I told what? Naked RNA virus. Naked RNA, if you remember PCR, naked RNA virus, that's what's important. PCR in that P pics are naked. But under picorno, what comes? We have P-E-E-C-C, that is P corona, right? RNA. RNA, okay? Once again, RNA, fine. So this P, first P is for polio, entero, polio, entero, echo, C for Coxsackie. R is rhinovirus, okay? So you see Coxsackie comes here, Coxsackie is coming. So it is a naked RNA virus. Okay, got it? So that's very important. So classification of bacteria is very important. Examiners love that. Okay, so for good score, good marks, you should know this very well. So this is so DNA is cut. I'm going to cut the DNA. Second one, what I'm going to cut? I'm going to cut the double stranded also. I'm going to cut. It is a single stranded only. There is no way. This is a normal single stranded RNA only. So single stranded RNA is right. Here also we have one, but naked. That's very important. You got a word naked. Naked, small, naked, single stranded RNA virus. This is one of the Coxsackie B virus which belongs to RNA. That's all. This way you can rule it out. Okay. Very important. So virus classification, we already spoke in the front topic. I'm not going to talk it here. This RNA, DNA virus, same thing. Okay. Right. Next. About Coxsackie virus. Yes, you can expect a question. You know two things are there. We have Coxsackie A and Coxsackie B. Coxsackie B. Coxsackie A, more it causes, I usually call it as 3-half, 3HAF I call. Why is it 3H? Because one is herp angina, other one is hand, foot, mouth. Hand, foot, mouth, repeatedly they're asking, I don't know why, hand, foot, mouth disease, which is basically A16 causes this, okay, herp angina. And other one is your herp angina, hand, foot, mouth disease, and hemorrhagic conjunctivitis. Hemorrhagic conjunctivitis. A for aseptic meningitis. F for flaccid paralysis. Flaccid paralysis. B, only this one will come in the B. Okay, you go aseptic meningitis. And B for something, the name is B. This disease is called Bornholm disease. It is basically due to spastic paralysis. Just because of spastic paralysis, the patient would have like tetanus, devil's grin, stiffness, muscle cause tetanus type. Okay, that's called spastic paralysis. Bornholm. B for B for Bornholm. Another thing important is your pericarditis. Pericarditis is again characteristic for Coxsackie. That's it. These are the things you should know. Okay. This question was asked repeatedly as a hand foot mouth. And here this is because of placid fallacy. So after alphabetically A, then come F, B, then come later, right? After A comes B, after F only comes your S at last. So B and S like this. Okay. Remember like that also. It's B easy. Okay. Fine. That's all. Okay. Now, families are important. Okay. So sometimes they can ask Flavi, always they ask this question, they frequently ask this. Okay. Now, before going there, see Flavi, whenever you talk about Flavian flow is very, very important. Flavi, all the flavor things. See, I remember like this, when you talk about flavor, you have papaya flavor. Who has papaya flavor? Then some people have what flavors? Noodle, noodle flavor, sushi, fish. Okay. Sometimes Mysore Pak, the Tamil Nadu sweet, no, the soft one, ghee sweet, Mysore Pak. Okay, these are something papaya and yellow mango. Of course, yellow mango flavor. These are different flavor. Whenever I say papaya, I'm talking about dengue virus, right? Dengue. Dengue, everyone say papaya is good for dengue. So dengue virus. Noodle, which noodle? Zika noodles. Zika virus. Zika noodle has a very good flavor, right? Sushi, Japanese encephalitis. Japan means sushi. Fish, West Nile. West Nile has lot of good fish. So flavivirus. Mysore Pak, because KFD, Koisnur forest disease. KFD is Koisnur. Koisnur is Mysore only. So Mysore Pak. Yellow mango, yellow fever. That's all. These are the yellow flavivirus group. Very, very simple. Okay. Now, what about yellow virus? I would say in Hindi, Phil Bolo ka mara hai. This guy Phil, this is Phil Bolo ka mara hai. Okay, mara hai. That means in Philoviridae, we have two. This question recently also came. Bola because Ebola. Ebola plus Mara Marburg. Philovir, just two viruses. Question. Okay, important. So now let's match. And also don't forget in flavivirus, there's a chocolate flavor also. Chocolate flavor for which virus? Hepatitis C virus. Chocolate flavor. Okay, chocolate. Nifa, so already told, Nifa comes under परम नहीं है परम नहीं है सो पैरामिक्सो जिका फ्लेवर जिका नूडल फ्लेवर फ्लाविवायरस एबोला विल बोला को मारा है फिलोविरिडे HIV is a retrovirus we know that so see I become very easy I don't confuse at all I remember the flavors and I remember the fil bola ko mara hai my topic is over I got it easily right so these are things if you do good definitely your rank is going to very very high okay so please if you not revised session now is the best time just give 10 minutes and finish it up okay in short and sweet your revision of micro should be over with this 50 questions you should be too strong okay that's all so a is 4 A is 4 B is 1 A is 4 B is 1 C2 this thing right okay done we are done with the this thing another classification next one you see 18-year-old were present with the fever and the vomiting 18 year by eating pastries that's all nearby bakery 3 hours ago just 3 hours cap this question is repeated food poisoning so which enterotoxin responsible why whenever you hear the word less than 6 hours food poisoning you think only two things one is your staphylococcus aureus and other one is your B series bacillus cereus you know it's always the word should be fried rice okay recooked reheated fried rice should be your Chinese fried rice okay whatever Staph aureus means anything with the milk product, pastry, milk, pastry, cake, cream, poultry. These things should be Staph aureus. Okay. Now, importance of toxin. For Staphylococcus aureus toxin, we know that all the toxin, enterotoxin, A to, so much is there. A to usually A to A, B, C, D, E, F, A, B, C, D, E. And then again, GH another, except one thing, except HEF. Why? HEF is fatal. And it causes what syndrome? Toxic shock syndrome. Again, repeated question. It causes the toxic shock syndrome. So F is out of option. That's all. Okay. This way you can easily remember. Got it. Next. A 16-year-old male brought to your clinic complaining of severe left-sided facial pain. Pain is there. And he was states that sitting at home first he noted a multiple irritation phase just 3 hours ago. There was mild irritation. Now he has pain and redness, exhaustive pain and redness. And the fluid, and then other complaints include flu-like symptom, etc., not important. So per examination, you can see bright red erythema over the right cheek. This is the picture. You can see bright red. Okay, and it's, if you see, it is demarcated well, very well. It's demarcated, margins are there, and significant tenderness. So when you have a demarcated margin, then you call it as erysipelas. If it is diffuse, if the lesion is diffuse spreading everywhere, you put it as cellulitis. Both are common in diabetic patient, but the cellulitis more in DM patient, diabetic mellitus patient. Okay. Now, erysipelas, it's right. And whenever you talk about erysipelas, which is the one it's causing? Streptococcus pyogenes. Streptococcus pyogenes, or we call it as group A streptococcus. Okay, same thing. And you know, characteristic for streptococcus is, what are the two tests? Bacitracin sensitive, PYR sensitive, and typical beta hemolysis. You should have a beta hemolysis. Okay, I hope it's coming now. Okay, beta hemolysis, and it's a streptococcus, so it should be in chains. It should be in chains. Okay, so erysipelas, right? On gram stain, gram positive coccus in clusters. No, it's not clusters. It should be in chains. It will be like this in the chains. We're talking about it now. Causative agent based, definitely yes. On blood agar beta, definitely it's a streptococcus pyogenes. So your answer is, this thing is wrong. Okay, so how to differentiate? So look at the picture. Two bacteria is always, when you talk about a gram positive cocci, it will be purple in color only. It's purple color, same color like this only. See, the grapes also is looking same color. Okay, like this only. So two things. One is staph. Staphylococcus is this. Why? Staffs, hospital nursing staffs like what? Grapes. So it is a grape-like cluster. Okay, it will be like this. The cocci will be like grapes. Okay, so you call grape-like cluster. And always Staphylococcus, cat. Everybody in staffs have cat. So catalase test is positive. That's it. This is the main thing for Staphylococcus. If coagulase positive, you call it Staphylococcus aureus. But with catalase and grape-like cluster, you use Staphylococcus. But this is your chains. When you see a chain, you see who's wearing a chain? A stripper. A stripper is wearing a chain. So that means this is Streptococcus. All the Streptococcus are chain. They are GPC in chain, not cluster. They should be in chains. Okay. Now, based on the hemolysis, you can see here, first one is called beta hemolysis. This is alpha. Last one is gamma. Okay. Whenever, don't confuse, you go in this order. First beta, then usually alpha, beta, gamma. Here you talk about beta, alpha, gamma, you go. Okay. Now what about beta? Beta hemolysis means complete. Whenever you get a beta, when you get a good tips, your life will be complete, right? So beta is complete. When you have a beta or beta, your life is complete. Remember like that. Okay, complete. So partial, alpha is partial. I always told, remember, alpha men, they used to say they are nothing. They simply put Rama, nothing. They are not bold and all. They are half only. Okay, always half, partial. Remember like that. Okay, gamma is gamma, no hemolysis. There is no any hemolysis. Okay, partial. Now, what about this thing? Now, so complete means your life will be in order. So you put it as group A and group B you put. Okay, group A is your Streptococcus pyogenes. Group B is Streptococcus agalactiae. We are in bacteriology now. Okay. Partial 2 or partial 1, I always say Viru. Virat Kohli is a partial alpha man. So remember it what? Streptococcus viridans. Okay. Virat Kohli. We have a lot of pictures in the main class. And the other one is your Streptococcus pneumoniae or pneumococcus. Okay. Streptococcus pneumoniae. No hemolysis means enterococcus. That's it. Okay. And of course, Streptococcus bovis also will come under this family. That's it. Okay. So there's no hemolysis. Right. Next. That's the way I would remember. Look at this question. Now here, a patient with this damaged heart valve developed fever for months with a new heart murmur. Blood culture showed some gram-positive cocci in chains. That's all. Simple. Heart valve is damaged. Fever, new heart murmur means we're talking about infective endocarditis. So, whenever there's a damaged heart means it's usually subacute. Infective endocarditis. It is already said gram-positive coccoenchia. So definitely it is one of the streptococcus, not Staphylo. It should be Streptococcus. And we already say that, I already said, who has a damaged heart? Virat Kohli. Our Virat Viru, he has a damaged heart. I told remember like that. Virat means itself, you're thinking about what? Viridance. That's all. A damaged heart goes to viridance. So, in viridance, Viru, everything is negative. There is no any specific test. Everything is negative about Viru. Okay? No any specific test for Viru. Everything is negative. Okay, so you got it. And I already told you Viru is a alpha man. He's an alpha man. He's not a beta man. He's an alpha man. Okay, he say alpha alpha, but partially MLS. I told you. Okay. So beta MLS is cut, not. Alpha definitely yes. Bile solubility negative or positive. I told everything about Virat is negative. So alpha and bile solubility negative. If it is positive, then this is more a Streptococcus. This alpha hemolysis bile solubility positive means that is Streptococcus pneumoniae, which doesn't have any link with infective endocarditis. It doesn't cause any infective endocarditis disease. Okay. So that's all. These are the main things. So alpha, Virat Kohli, and everything is negative. That's it. Okay. Now match this following. This is another interesting question. If you see, look at the appearance and you can answer me. The first one you can see, this is a bamboo stick. It looks like a bamboo stick. Second one, boxcar. You see, it looks like a car, boxcar. Okay, boxcar appearance. Boxcar, bamboo stick. And then this is your Chinese letter. Chinese letter pattern, you can see. The last one is filamentous. Filamentous gram positive. Filamentous gram positive bacilli, right? Now, boxcar, you know, whenever talk about bamboo stick, who was bamboo stick? Andrea, actress Andrea. Andrea, I'm talking about anthrax. Bacillus anthracis. Boxcar means who has a car, lot of car at home? Our Nagarjun. Nagarjun means Clostridium, Mr. Perfect, Clostridium perfringens. Clostridium perfringens, Nagarjun. Nagarjun because of Naegler's reaction. Nagarjun, Mr. Perfect, he has a lot of car and clubs also, right? And Andrea has a bamboo stick in his one hand and inverted fig tree in another hand with her medusa head and pearls, you told. Chinese letter, of course, always our diphtheria. Then, filamentous. Filamentous means you think about only two people, either Israeli guy, actinomyces, or our Noraphyti nocardia. Noraphyti nocardia, right? Okay. Bamboo stick, you see a bamboo stick. What is this? Is you remember? Either Heidi Potter or ulcer. It's gone. Okay? Ulcer. Got it. It's a pulmonary anthraxis. Dangerous one, most dangerous one. Boxcar, so it is a gas gangrene. So excruciating pain with crepitus, that is gas gangrene. So our Nagarjun, what happened? In his movie shoot, he got severe injury and ended up getting gas gangrene. Chinese letter means it's a pseudomembrane. A pseudomembrane is a membrane that bleeds on removing, right? Pseudomembrane. These two, actinomyces nocardia, very characteristically causing something called mycetoma. Mycetoma, a swelling with sinus granular discharge is called mycetoma. That's all. Direct questions. Okay. So no mistakes in this. So your A is 2, option A is 2, B is 4, C 1, and D is 3. Very good. Okay, we got it. See, whole topic is finished. So this is the Andrea story, because this is, you remember, I told to remember Andrea. Whenever Andrea is South Indian girl, so Andrea, anthrax sounds similar. Okay, we already know that important thing is this. Look at her head, medusa head colony. Okay, she has a medusa head colony. This is the one you're seeing. This is a medusa head colony, and then she's wearing a beautiful what? Pearls. Okay, so this is the bisected pearl. Okay, we can say pearl reaction or chain of pearl, whatever. So this is pearl reaction. Okay, in penicillin agar. And then I told one hand to remember she's holding a bamboo stick. She's holding a bamboo stick. On the other hand, she's holding a inverted fir tree. Okay, inverted fir tree. So this is the one. So this is the one. This is the bamboo stick. This is inverted fir tree. Inverted fir tree. So important for Andrea anthrax, right? And don't forget the capsule here. This is the only place capsule is made up of polypeptide. That is amino acid. Amino acid polypeptide. So A for anthrax, A for amino acid. Why our cool Madhavan is here? He is our cool Maddie. is a pilot. Okay, is a pilot. Why is it cool? Because cool Ascoli thermoprecipitation. Ascoli. Okay, it is Ascoli thermoprecipitation test. MADI because the reaction name is McFadden. McFadden is again it's for capsule. Methylene blue you add and you see the capsule swollen. So McFadden. Pilot because the selective media name is called PILET media. Okay, PLET, even not I, PLET, PLET. Polymyxin, lysine, PL, it EDTA thallus. You remember only PLET media. That's all. This for MADI. Okay, MADI reaction. Okay, that's all. Bamboo stick, everything we said. So this one I told. Why did I put Nagarjun picture? Because it's important. Mr. Perfect, Mr. Perfect Naga, Mr. Perfect Nagarjun or Naga. Why? Because Mr. Perfect Clostridium perfringens, Clostridium perfringens. One question came again in the FMG just recent exam. And then Mr. Perfect is Nagarjun and Naga because Nagler's reaction. Nagler's reaction. Okay, Nagler's reaction. Okay, he is the only fellow having cap. So this is only capsulated. This is only capsulated Clostridium. We're talking about Clostridium. Okay, he has a target. He has a target. So why did he say target? Because this is a target. See, this one. Target hemolysis. Target or double zone hemolysis. Double zone hemolysis. That's what we made as target. See, he is the owner of lot of clubs and cars. That's because boxcar appearance for Naga and club because spores are club shaped. Spores are club shaped. Okay, club shaped. Very important. Easy. Okay. Then he's a crazy fellow. So he do reverse camp. He always do reverse camp. Reverse camp. In reverse camp, what happened? The center one, the side one is always the group B, agalacti. Group B, Streptococcus agalacti is always here. And here instead of Staphylococcus, you put what? Clostridium perfringens. That's what it is, reverse. Okay. So in normal camp, I'm going to write in normal camp, it will be just the group B Streptococcus agalacti and Staphylococcus plus Staphylococcus aureus. Okay, same thing. The group will be same both the places, but instead of Staph aureus, you are putting Clostridium perfringens. That is called reverse camp. Okay, and I told always he drinks. This is Nagler's reaction. This reaction, toxin antitoxin is Nagler. Naga reaction, Nagler's reaction. So this you see in egg yolk agar an opalescence. If it's toxin antitoxin mechanism, you will see an opalescence. That's all, Nagler's reaction. Okay, so the double target zone, double zone hemolysis. These are the common features in the Clostridium perfringens. Okay, which cause a gas gangrene. You know that one. So, okay, so question. Okay, so wait. Where is this? Yeah, we are going to next question. We talked about Nagarjuna. Now we go to the question. So if you go to the question, you see here. Yeah. So a military officer blast injury, emergency department. Examinations of crepitus, site of injury. Crepitus means gas means gas gangrene. A sample was sent for gram stain. They found gram positive rods with no spores. Okay, usually in gas gangrene there will not be spore. It's a club-shaped spore, but we all know very well in gas the spores will disappear. It will not be there. You can't find a gas in the spores there. So which of the following is not catastic? Okay, now which is not catastic? So this is basically we're talking about a Naga. So this is a gas gangrene. Everything is about our Clostridium, Mr. Perfect, Nagarjun. Mr. Perfect, Nagarjun. Okay, Clostridium perfringens. Nagler's reaction is positive? Definitely yes. That's what the name itself, he said, Naga, right? Naga, correct. Reverse campus test? Yes, he's a bit crazy fellow. Grows in MPA Pempa? Let's come there. Target hemolysis? Definitely yes. Double zone hemolysis. This is also correct. This is wrong. Why? MEPA Tempa are culture media for Bacillus cereus. Be serious, okay? Bacillus Maipa Pemba restaurants, I told. Remember Maipa Pemba restaurants where the Chinese fried rice is very dangerous. So that's what, okay? So that is for that one. So it will not come here. So this way you rule out. You get it, okay? It's important. So already I told everything. So that's it. Fine. Next one, assertion. Look at this question. Myocarditis is one of the complication of myocarditis is one of the complication of diphtheria. Yes, true. Due to bacteremia? No, that's wrong. It is always diphtheria is totally toxinemia. That's what we give antitoxin as a treatment. So assertion is true, reason is false. Okay, it's not bacteremia, it is due to toxinemia. So that's the main thing you should know. Okay, so remember this is mostly toxinemia. So this is your Albert stain. You know the granules name what? Babes Ernest granule, Babes Ernest, or volutin granule you call volutin, or sometimes you call metaphosphate granules they call. Okay, granules. So all stained by Albert, but of course we have four stain plan. Always say plan to stain for diphtheria. Excuse P for each stain name, right? So first one is Ponder, L for Loeffler's methylene blue, A for Albert, N for Neezer. So these are the important stains for Babes Ernest granule. Okay, that's it. This is LSS media, Loeffler serum slope, and this is your Loeffler's serum slope. Okay, and this is your potassium telluride agar, potassium telluride agar, you know very well. So Loeffler serum slope, always I told, remember, in whenever you go to a diphtheria ward, you have to tell the doctors not to loaf. Okay, you have to doctors not, you have to tell the doctors. Okay, you have to tell doctors not to loaf around. Tell for potassium telluride, low for Loeffler's serum media. What is important here? Loeffler's Hef is there fast. Here the growth will be within 8 hours. So that is what this is, enrichment media. Whereas here this is a 48 hours, but it is a selective media. So it's conformed media, selective media. Okay, that's the difference. Potassium telluride, sometimes you call it or Tinsdale also. Tinsdale agar you call. So they are selective media. This is an enrichment media. It takes less than 8 hours. There it takes 8 hours. Okay, that's all. Now, what a TB test also, always they ask one question. TB, you know, all of the following diagnostic method of TB except. So except is, of course, see, all are right. This, when you talk about bacterial midget, they are the automated culture methods. This is right. This is definitely right. Gene expert, of course, that's a PCR. Basically, this is a PCR molecular method. These two line probe assay, they are the best molecular methods. LSS, no. It should be LJ media, Lowenstein-Jensen media. So that's a wrong answer. Okay, wrong answer. So this definitely, you see this when you talk about culture, this is your LJ media. Conventional culture. When you talk about culture, this is the conventional culture media. But of course, we have automated. When you talk about automated, now everything is automated. So in automated only, you're talking about this Bactec, Bactalert, and Bactalert and Midget. These things, these are automated. LJ media, that's all. Okay. And other molecular, you know, gene expert. One important thing in gene expert and this thing is gene expert, or we call CBNAT. We call CBNAT. You call, okay. Both are same. Other one is your line probe assay, LPA, line probe, this one, okay, line probe assay. The difference is in gene expert only rifampicin, resistance is detected. Here, all anti-TB drug resistance is detected. That's one difference. Okay, that's all. This is the main thing. Otherwise, both are molecular only, both you can use. Okay, this is one point I wanted you to stress. Next one again, if you see, 45-year-old renal transplant recipient with a fever, chills, headache, confusion, vomiting. CSF sold a gram-positive rod exhibiting tumbling motility. That's more important. Okay. Following is likely. So CSF fluid, you're seeing a tumbling motility. So which of the following is likely mode of transmission? First of all, which organism we are talking? So which organism we are talking is, we are talking about our tummy Lisa, right? We know this girl called tummy Lisa. Tummy Lisa, this is at age of 25 and age of 37. Okay, 25, she's active. And Lisa, 37, she's lazy. She can't even move. Okay, no movement. I mean to say tummy, because this is tumbling motility. Tumbling motility. Which bacteria, Lisa? Listeria. Listeria. Okay. And then why this difference? 25 degrees Celsius, they don't move. 25 degree Celsius, motile. And at 37 degree, non-motile. So this is typically called as differential motility. Differential motility. Okay, differential motility. So that's what this motility is basically tumbling. So tumbling differential all goes to which this is Listeria. The organism which we are talking here is Listeria monocytogenes. Okay, and what happened? This comes under gram positive beta. If you remember, I told for gram positive, which is looking purple color, the shortcut is McDonald's. M for mycoplasma, 2A, A for anthrax and A for actinomyces, C for Clostridium, D for diphtheria and diphtheroids, N for nocardia, L. This L is basically Listeria. McDonald's group. Okay, I'm not going full detail. We have to revision is past this revision time. So it's a Listeria monocytogen. Listeria monocytogen is one of the common cause of third most common cause after E. coli and your group B. It is one of the common cause of neonatal meningitis. Neonatal meningitis. Okay, so this is one of the it causes multiple. It can cause usually it results in abortion, or it causes the meningitis or sepsis. All these things it can cause. So in one condition is this is called as a complication cause. It causes granulomatous infantoseptica. Granulomatous infantoseptica condition. Okay. This is inside when child is inside, you can get this thing, and when the child comes out, you can see granulomatous infantoseptica. Okay. So what's the root? It is usually food root. Okay, fecal-oral route. So mostly contaminated food is the main reason here for Listeria monocytosis. It's not respiratory route anything. Usually milk or meat or whatever, but usually milk is very, very common route here. Okay, so this we have done. Okay, now that's it. Next one again, expected Neisseria questions are always asked. In Neisseria, child is admitted with again say high fever, vomiting, irritability, petechial rash all over the body. Okay, Kernicks-Budinsky is fine. So it's a meningitis. CSF gram stain should following image. Okay, so we are going to do this. First of all, it's meningitis. Gram stain, they showed following image. You can see, if you enlarge and see, you see a diplococci. It's a gram positive diplococci, right? So it is basically what you're seeing is a gram. This is a gram negative because it's pink, it's red in color, red or sort of pink. Okay, gram negative diplococci. And it is like this lens shaped. It is lens shaped. Okay, lens shaped. Okay, before going to the topic, let's briefly see these two organisms. Okay, so when you talk about Neisseria, two things. One is a Neisseria meningitis, the other one is a Neisseria gonorrhea. Look at the picture. If you see the picture here, it is usually lens shaped. Both are diplococci. One is lens shaped like this. Lens shaped. Other one is bean shaped or kidney shaped. Kidney bean, whatever you can say. Bean or kidney. That means it's like this. Yes, you can see here inside. It's all inside the cell. Mostly they're intracellular, but can be outside also. So bean a kidney shaped. First point. Second one, they are capsule. When you talk about the capsule, it's positive, here it's negative. Then when you talk about the biochemicals, meningococci, M and G is here. So it will maltose plus glucose fermented. But only G is there, so only glucose fermented. Okay. Then otherwise, transport media. We need transport media here. We need transport media for gonococcus, MEs and strout. Here we don't need it. Otherwise, other medias are common. What are they? Nisha's boyfriend is Thyre-Martin and New York. Both are used. In both the cases, we are using. Okay. But transport media is only for the gonococcus. That's main thing. Okay. Now, virulence factor, if you see, yes, capsule for meningitis, Neisseria meningitis, capsule. for Neisseria meningitis. Okay. Complication of Neisseria meningococcosis and the risk factor also. Neisseria meningitis commonly seen in which patient means you see this C5 to 9. This is also called membrane attack complex. Membrane attack complex. This deficiency, in this deficiency and asplenism or no spleen, splenectomy, asplenism or splenectomy. These are the, because in any of this, capsulated organism will be common. So, but especially membrane attack complex is an important question frequently asked. Here, meningococcus, membrane attack, meningococcus. Okay, meningococcus. Complication only you should know that it causes what? Waterhouse-Friderichsen syndrome. Waterhouse-Friderichsen syndrome. So, this is basically adrenal gland hemorrhage. Adrenal gland hemorrhage. That's all. Okay, adrenal gland hemorrhage. So this is the common one. So that's what. Not only that, also they have purpura fulminans. Purpura, when sepsis, if it becomes sepsis, both cases, the main complication is sepsis. Because of sepsis only they get purpura fulminans or Waterhouse-Friderichsen syndrome, right? Okay. So now go to the question. You can see here, optochin. So which is characteristic for this thing they are asking. So optochin sensitivity, inulin fermented positive, definitely not. These two are for, I told shortcut is bio, solubility, inulin, optochin is for Streptococcus pneumoniae. Another important question, okay? Optochin, O for optochin, I for inulin fermented, B for biosolubility, okay? And water can perineum is for gonococcus, because it's in the perineal region you have this pus collection. It is gonococcus. Needs X and V factor, that is totally Haemophilus influenzae. Haemophilus influenzae. Cause disease in a complement membrane attack is right answer. Just now I told C5 to C9 membrane attack complex goes down, then this infection will be high. So that's the right answer. Perfect. Okay. So expect one question here also. Now, next question. Look at this one. Here, a 34-year-old patient, history of beef consumption, now is having bloody diarrhea and severe abdominal pain. Stool culture, they said that one of the E. coli variant is seen, which is producing a pale colorless colony in a sorbitol mekong agar. Okay, sorbitol mekong agar. So that is basically, you already talk about bloody diarrhea. When you talk about bloody diarrhea, severe abdominal pain itself, the clue is EHEC. Okay, enterohemorrhagic E. coli. Again, with this pale colors, usually in sorbitol, all the E. coli will be pink color. But only here, colorless will be there. That's also EHEC. This is a clue. Now, we'll go to the test. You know that in EHEC, this is the common variant is O157. H7 is the main variant. Right, correct. So, false they asked. Complications, hemolytic anemia, definitely yes. Okay, hemolytic uremic syndrome. Cerny test is positive. No, that is wrong. Okay, I'll tell you what. Cerny. Toxin active 60 is definitely yes. Definitely yes. Okay, now, yes. Now let's see about each. We are going to write a little bit, yes, diarrhegenic variant. E. coli, you know, when you talk generally, when you talk about E. coli, you know that it is the most common cause of many things. What are they? It is the most common cause of UTI, any UTI. And again, most common cause of your neonatal meningitis. Okay. Again, most common cause of bacterial abscess, bacterial abdominal abscess, or most common cause of primary and secondary peritonitis. So these are the few things it can cause. But when you talk about diarrhea variant, you know very, very well, very important, you should know. EP, enteropathogenic E. coli. Okay, then we have entero-invasive E. coli. And then we have enterohemorrhagic E. coli. And then let me T first. Okay, first let me finish the T and enterotoxigenic. Then comes the enterohemorrhagic E. coli. And then comes the enteroaggressive E. coli. Okay, enteroaggregative. EPEC, you already have a clue. P for pediatrics. So childhood. So this is what this causes childhood diarrhea in child. Okay, diarrhea in child. And there's some special things it forms in the intestine when it erodes the, let's call pedestals. It forms pedestals, okay, pedestals in the E. coli, okay, PPP, everything goes with PPP here, pedestals, okay. Invasive, entro-invasive, I always say this is very much like a, I'm going to write it here, 1 second. So this is, it is like shigellosis. It is like shigellosis, but not that much severe, mild only. Mild, it's not that much complicated like EHEC, it's mild only. One test positive here, it is called Sereni test. Sereni test. I always say Serene is invasive. Serene is invasive. Okay, Serene is invasive. Invasive, remember like that. T for travelers. This is causes travelers diarrhea. T for treat or travelers. This is a mild form. These are a mild form. Travelers diarrhea. Travelers diarrhea. That's it. Okay. It's very much mild one, not that serious. Enterohemorrhagic is the one which is very dangerous, especially E157H7. Important thing is that it causes hemorrhagic colitis. Everything is about H. Hemorrhagic colitis. And also it causes Hus syndrome, hemolytic uremic syndrome. Okay, hemolytic uremic syndrome, very important. This is because very similar to the Shiga toxin or Shiga-like toxin. So it's like EHEC, it acts through which mechanism? It acts through Sheila anti 60 years, right? 60 years Sheila anti. So 60 years subunit, that's the main thing. And then decrease the protein synthesis. Decrease protein synthesis. Then cause the diarrhea. That's the main thing. Okay, all the pathogenic mechanisms. In Hus syndrome, the main shortcut is to remember I told rat. Okay, R for renal failure, A for anemia, that is especially hemolytic anemia. We are talking about the hemolytic anemia. So because of hemolytic anemia, you have something called schistocytes. Cystocytes, okay. That is the broken RBCs are called cystocytes. And T for thrombocytopenia. Thrombocytopenia. This is the classic future. Okay, that's it. Rat. Okay. Renal failure, anemia, thrombocytopenia. That's it. So it's a dangerous one. So when most dangerous one is which one means EHEC. EH157H7 is the most dangerous one. Okay, you know this one. EHEC is basically enteroaggregative. We call it as enteroaggregative. Enteroaggregative. This causes persistent diarrhea. Usually it causes the persistent. It causes persistent diarrhea. Yeah. And here aggregate the bricks, aggregate the bricks. So you have a brick-like appearance, okay? Brick-like appearance in cell. If you grow it in the cell, your brick-like appearance is seen. That's it, okay? Nothing else. Persistent diarrhea and enteroaggregative. That's it. EA is very simple. So this you expect one question, okay? Yeah, so that's very important. Now, next one is your lag, always growth phase. Not going general topic. Always you have a growth phase. Growth phase cycle is always, once again, nothing wrong in going one more round. Okay, be careful. Very, very important. Show this phase start like this: lag, log, stationary, and comes. Okay, so the first phase is always the lag. A starts. If many people confuse with log and lag, first is always the lag. Second one is the Second one is the log phase. That is the log phase, or also called exponential. So don't get confused. Exponential. You will be very exponential in log. Okay, that is college phase. Third one is your stationary. And then the last one is your decline phase. DEC decline phase. Okay, stationary and decline phase. Okay, now, so this is your third phase and this is your fourth phase, decline phase. This is your first phase, lag. Lag is always lazy. I say lazy phase because you are at home, vacation. So you only eat and what happened? Your size goes maximum. So same way, bacteria size maximum. Okay, maximum size happens in which phase? Means in the lag phase, growth phase. If we are talking about the growth phase of the bacteria, growth curve. Log is like college. Log, college. See, sounds very much college phase. When you go to college phase, what happened? You have to definitely decrease your weight to impress your boys or girls. You could decrease the size. That means what happened? Here, cell division, the bacterial cell increases. So size decreases. But what happened? Definitely the cell multiplication is more. Okay, so it means the size decreases and multiplication increases. The cell division increases, same meaning only, nothing else. Now what happens? So size decreases and then cell division is increasing. Now you have to be active. You're in college. So what you do in college, what you do in the lab, microbiology lab, you will be putting biochemical tests. So best for biochemical test, putting AST test, antibiotic sensitivity testing, biochemical test, even for staining, any staining. So which is better? Log or exponential phase is the better. Remember like that, okay? So in the lab, when you're in college, you go to your good, first of all, you do a lot of exercise. So your size decreases and then cell will multiply more, okay? And then biochemical, AST testing, staining, you do all these things in college lab, okay? That's a stationary phase. The shortcut is already there is STAT, okay? STAT, T you make it as a B stab. So S for spores and storage granule. Spores or storage granules forming here. Okay. T for toxins. You talk about different toxins, especially exotoxins we are talking. It is formed in this phase. A for antibiotics. Antibiotics. And B for bacteriocin. Bacteriocin. These all are formed in this phase. In stationary phase, what happened? Number of live is equal to dead bacteria. Number of live bacteria is equal to dead bacteria. In involution form, decline form is involution form, everything is killed. Okay, everything is killed. Okay, right. Now, here, the previous question, did I mark the answer? Yes, we have marked. Cerny test is not for that. Cerny test here, sorry, Cerny test should be coming for invasive serine, EIEC. Okay, EIEC. Right. Next one here. Come, now let's see. Lag phase is a lazy phase. So what happened? Here, maximum cell size. So 2. Log phase, everything is active. So cell divides exponentially. That's what exponential phase. Stationary, yes, yes. So storage granule and even spores also, it's right. If they give you spores, that's also correct. Yes, yes. Okay. Decline is an involution phase, 3. So 2, A is 2, B is 4, and C1, D3. That's it. Very, very simple. Expect one question, guaranteed. Okay. That's all. You'll get one question from there. Now this one, next one. So look at this picture. In first picture, I'm seeing a bacteriophage. Identify the genetic transfer mechanism. I'm seeing a bacteriophage virus here. See, it's here. So whenever a bacteriophage investor, I told, remember shortcut is BDS. BDS. B for bacteriophage, D for duction. S for staphylococcus example. Duction, so transduction. So this one is, see, a bacteriophage is involved in cell membrane. So I'm going to say it as a transduction. Transduction. Okay. Here I'm seeing a free genetic material. This is a free genetic material is taken from the free genetic material. It could be DNA or RNA, a free genetic from environment is taken inside the bacterial cell. So if something free comes, automatically what comes? Transformation will come. Transformation, FF. Okay. So one is my transduction, D for duction, D, BDS, formation. So my answer should be transduction and transformation. Answer is already marked, sorry. So it's transduction, transformation. Very simple. And lysogenic conversion, lytic phase, you know that there also, the bacteriophage is also involved in, I want to write it here, bacteriophage. Bacteriophage is involved only two things. One is your transduction, just we spoke, BDS, and other one where it involves during your lysogenic conversion. During your lysogenic conversion. In lysogenic conversion, you know the example, especially I always have to remember scarlet bed, Viba. Viba sleeps in the scarlet bed. Scarlet is because scarlet fever. B for botulinum. E for E. coli, these all are undergoing lysogenic conversion. Their toxicity is mediated to this only, or they spread the infection thing to this only. Okay, E. coli. And D for diphtheria. Diphtheria is repeatedly asked question. Diphtheria. And Vibrio cholera. Okay, Vibrio cholera. So these are the things for the lysogenic conversions, bacteria. Okay, so this is also important. Noted. Yes. Now, microscope. Definitely one question also asked from here. Usually, you know. Light microscope, always, I remember T is there. I always told you to remember T for transmitted light, T for transmit, T for T. Dark field, dark, R is here, R, okay, I'm not writing pen only. T is here, D, A, RK, dark. R for reflected light. This is transmitted light, reflected light. Fluorescent line U is here. U, so it is UV light and the dichromic mirror. Electron microscope, you know, it is always a tungsten filament. Electron is the source. Electron is the source. Okay, so simple. Okay, T, transmitted light. Dark, R, so reflected light. R, it starts with R, reflected light. UV light. Okay, tungsten filament in electron microscope. Right. So here the answer will be A for 4. A for 4, B is 1, C is 2, yeah, C is 2, D is 3. That's all. Okay, simple. So the light can be also one question they can ask. Okay. And yeah, and maximum what they can ask you, if you want to convert a light to dark microscope, dark field microscope, the thing to be changed is a condenser. You change into the condenser. Okay, that's very important. And always note, condenser is always below the stage. It is always below the stage. Okay, below the stage. That's one important point. Okay, that I want to stress. That's all. Okay. Yes. Yeah. UV light dichromic mirrors for fluorescent microscope, electron microscope, tungsten filament space and all. Right. Okay. For viruses, best is again electron microscope. Fine. Now we are not going to detail because this is a revision. So most thing, that the things which you shouldn't forget, that only we are stressing. Okay. Now match the following with the selective media. Selective medias, we have to match it. Okay. So here, before going to the selective media, this is a shortcut I always told. Whenever you think about, this is our Salman and Sheila. Shigala, okay? Salman and Shigala, Sheila and I told. So both of them share everything together. What is the common thing that they share? The DCA media, and then what else? Salmonella Shigala and XLD agar. These are the common medias. But this one, Salman bodyguard I told Wilson. Wilson is bodyguard only for Salman, specially for Salman, not for Sheila. So okay, Wilson, I'm talking about Wilson Blair media. Wilson Blair only for Salman. This is a Viba. This is Viba story, Viba. Viba's favorite, Viba is an IT girl. She's IT girl. So where she works in TCS company. TCS means Viba. TCBS. I'm talking about TCBS. Okay, TCBS is the idea here. And you know that her carrier media, she used carry Blair media. She carries what? She carries autoclaved seawater. But for end, this is for transport media, for transport. And also who? Venkatraman and Ramakrishna for transport. But for enrichment, she drinks what water? Alkaline peptone water. She drinks the alkaline peptone water. Alkaline peptone water. So selective media, this one, selective media. Whereas Salmon Shigella, for transport, they always wear what? Socks. They wear socks. So that is Sachs buffered. Sachs buffered glycerol. Sachs buffered glycerol, I told. But for enrichment, they drink what? They drink the broth. What broth? Selenite, have broth, or tetrathionate. Tetrathionate broth. But only thing is Salman, for special media, he has Wilson Blair. Okay, remember that. That's very important point. Okay. This one again, Diana, because when Diana comes, I always told you to remember plasma, because favorite thing, first of all, microbiologist, she is people's queen, right? She is people's queen. She eats what? Fried egg, eats lot of fried egg. Okay. Why do you say this is a Diana? Because only reason we have something called Dine's method in mycoplasma. Dine's method, you're staining the colony with methylene blue. That's what Dine's method. Whereas Dine's phenomena P Proteus. Okay, that's another story. Yes, Dine's method, but I'm going to write it once again. But when you talk about the Dine's phenomena, this is for Proteus. PP. That's all. Okay, Dine's method, mycoplasma, right? That's all. Eat and fried egg. Okay, that's all. And of course, we told she got a lot of cholesterol in her body. Okay, cholesterol. That's what Diana has what? Gliding motility. That's all. Okay, fine. Now, go to the question. Now it become very easy for you. So, Wilson Blair media. I told Wilson Blair is only for Salmon. Only for Salmon. So, this is, I'm going to write here, Salmonella. PPLO, who is people? Queen. That is a Diana. Diana means mycoplasma. Mycoplasma. Deoxycholate citrate, it can be both Salmonella and Shigella. Okay, it can be Salmonella or Shigella, Shigella, both are right. Now let's see it. Theosulfate TCS. TCS girl, who is a TCS girl? Viva. So Vibrio cholera. Vibrio cholera. Now, Salmonella, what infection it causes? Stepladder fever, because it's a typhoid fever. Typhoid fever, typhoid fever. So it is a stepladder fever. Typhoid fever is basically stepladder fever. So that is fine. That is also fine. Totally fine. Yes. Now, next. PPLO. PPLO is again mycoplasma, typical cause of primary atypical pneumonia, always called walking pneumonia. Diana likes to walk, so we also call it as walking pneumonia. Okay, so PPLO organism we call it as also. Yes. Now, PPLO is basically pleuropneumonia like organism. That's it. Okay. Deoxycholate citrate agar. Yeah, this causes the dysentery because that is Shigella. Shigella, no? Shigella. Typically, we talk about Shigella, so bacillary dysentery, right? Thiosulfate citrate TCBS is basically non-inflammatory diarrhea. That is basically rice water diarrhea. Rice water diarrhea. Rice water stool, rice water diarrhea, Vibrio cholera. That's cholera. Very simple, right? So A is 3, B is 1, C is 4 and 2. That's it. Very easy. We got it. Okay. So easily you would have get from that one question surely. Yeah. So we briefed all the important medias. Now match the sterilization method. Match sterilization method you know already. Yeah. So whenever we talk about hot air oven, we always say that anything glassy, anything dusty, anything oily or liquidy, okay, or anything sharpy we say, okay, glassy, dusty, oily, liquidy, okay, these things. Inspiration, it is basically in hot air oven, you know the temperature, how much it is, 160 degrees Celsius for 1 to 2 hours. Okay. So basically we stick with the 2 hours, 160 degree. You know this one. Inspissation and tinderlization. Tinderlization. Tinderlization, I told tin, you remember it as a tin, 10, tin, like this, right? 10. So why I said tin? Because see, in in tinderlization, 10 into 10 is equal to 100 degrees Celsius we use. Okay. And tin because tin of sugar. All sugar containing medias, we do tinderlization, 3 consecutive days heating, right? Inspissation, only 85 to 88 degrees Celsius, little bit less than that. And also, you can remember as ILL or double S, CF double S. So I mean to say inspissation 2L media. So one is LSS media, other one is LJ media. And both are interchangeable. Okay, both are interchangeable. That's also important. Okay, yes. And Holder method, you know, that is for pasteurization. We use 63 degrees Celsius for 30 minutes. And the same flash method we have, pasteurization flash method. So there you use 72 degree for 20 seconds. And in Holder method, the only bacteria you can't kill is Coxiella burnetii, except Coxiella burnetii, Q fever one, you can't kill. Okay, this question was also frequently asked. Okay, in Holder method, except which you can't kill is Coxiella burnetii. It escapes the this one Holder method. Flash is okay. Okay, right? Yes. Now hot air oven, anything glassy, dusty. Dusty is coming here, so dusting powder. So first is gloves containing dusting powder of the gloves. Okay, dusting powder of the gloves. Okay. Inspissation, just now we told ILLS, ill. Okay, ill. So ill, inspissation, LJ media. Autoclave, most of the thing, autoclave temperature, you know, 121 degrees Celsius, 15 minutes, 15 pascals. Pressure 15, okay. All 215s. So autoclave, most of a microbiology culture media is done in autoclave. So that's important, okay. Holder method is pasteurization method. Very simple. Okay, so one question definitely comes. So be careful with this question. Okay. Hot air oven, A for 1 and B is 4. Okay, C to D3. That's it. Very, very simple and easy. So no mistake in this question also. Yes. Next. Match the sterilization method, biological indicators. Okay, plasma. So for plasma and autoclave, we always know it is the best to autoclave also. Stereothermophilus. That's a standard baseline. Hot air oven, whenever someone say hot, all you remember is hot tea, hot, hot what? Atta roti and hot sabji. Okay, sabji. That means Clostridium tetani, Bacillus atrophius, Bacillus subtilis. Okay, Bacillus subtilis. Okay, now that's hot. This is brew, filter coffee. Whenever someone says which is the best filter coffee, you will tell what? Brew. Brew is brew Vendi monas. Brewendi monas. Brewendi monas. Okay, that's Brewendi monas indicator. Someone talk about the radiation. What will radiate? Puma shoes will radiate. Pumilis. Pumilis. Okay, Bacillus pumilis. That's all. Okay. Now, also one thing for that's for hot because hot air oven. This is for hot air oven. This is hot air oven. It will radiate. Pumilis. Puma shoes will radiate. Puma shoe will radiate. Brew filter coffee. Yes, one thing forgetting is gas sterilization. For gas sterilization, that is ethylene oxide. I told that my friend Dr. Eti, who's working in the ICU because Eti is very important for what? Respirator and heart lung machine. Heart lung machine. Eti leaves gas. Why she leaves gas is also called gas sterilization because here Eti's favorite is first of all atta roti. Then she likes what? Cauliflower, gobi sabji. Not tea. She likes only these things, atta gobi and gobi sabji. So this is a repeated question. Atta roti because Bacillus atrophius. Gobi because Bacillus globigi. Okay. Bacillus subtilis. All are important. Anything they can ask. Very simple. Finished. Okay. And for your plasma and this thing, you will have Bacillus stereothermophilus, standard one, right? So plasma is Bacillus. Hot air oven, just I told, either hot tea is here. Okay. Ethylene oxide, tea is only for our this one, hot air oven, right? Sorry, tea is for hot tea. Yes, only hot air oven. Ethylene, Eti is eating gobi. Eti's favorite is gobi sabji. That's what she's leaving. Gas, if you forgot also, there is GG. Okay, gobi, ethylene oxide. Gas filtration, brew filter coffee. So brewendi monas. Okay. So A is 3, B 4, C 1, D 2. Okay, fine. That's all. Okay. Now, this is the last question. Okay. Easy one, you'll find it. So, 55-year-old woman, uh, gait disturbances, positive Romberg sign, absent pupillary reflexes, so something related with the brain only. Okay. And her history noted for untreated painless gentle ulcer. Okay. That's painless ulcer, untreated comes means that you'll go with the syphilis. Syphilis. Okay. Syphilis. And look at this. This is now more it's not a primary, it's more a CNS related. So it is neurosyphilis. Neurosyphilis. Okay, neurosyphilis is basically type of tertiary syphilis. Tertiary syphilis, and you know that tertiary syphilis, the best test is always VDRL. First test is VDRL, followed by this the FDA ABS you can use. So the question is best for confirming the diagnosis, of course, Wendell Disease Research Laboratory. That's all. This much only. No, so very simple and easy. Only one thing. This we finish. Gentle ulcer. Gentle ulcer, when you talk, you can have pain, painless. So when you say pain, it's both your ulcer and the lymph node. Both are painful. Here, painless means ulcer plus lymph node, both. So here, most common painful is herpes simplex virus 2. Both are painful only. Okay. Other one is your H. ducrey. Cry, crying because you're crying because it's painful. So both are painful. Lymph node and both are painful. Painless, syphilis. syphilis. Okay, syphilis less. So both are ulcer also no pain, no pain, no pain. Both are no pain, no pain. Syphilis and also your granuloma inguinale. Granuloma inguinale. Klebsiella granulomatous, no? Inguinale. Both are no pain, no pain. Everything is fine. But in lymphogranuloma venereum, we have a problem. In lymphogranuloma venereum, ulcer is no pain. But lymph node has pain. L for L. So L for L. So lymph node, it has severe pain. This is one important thing. That's all I want to remember. Okay. So of course, chlamydia, it's caused by chlamydia, L1, L2, L3. Okay. Chlamydia, trachomatis variant, lymphogranuloma venereum. That I'm not going to talk about. So this is one thing important. Based on this clinical also, they can ask. Okay, each thing. Okay, that's it. Rest all we see. So these are the things you should know. And that's what here, the main thing when you talk about syphilis, you know that when you talk about the syphilis, you have screening test or non-specific and confirmatory test. And confirmatory test. Okay, this is non-specific. This is specific. Non-specific only two tests, VDRL, RPR. Okay, both are good for prognosis, treatment prognosis. Treatment prognosis, this is the best. But other things are confirmatory. We're talking about Treponema pallidum, not Treponema pallidum. So confirmatory test, everything there should be TPI, should be the TPI. Then you have TPHA. Other one we have TPPA, Treponema pallidum, hemagglutination, Treponema particulate agglutination. Last one is FTA, ABS. Here also you have T is there, T. So wherever this TTT is there, they are confirmatory tests. That is once positive, always positive. But this one, VDR RPR, based on the titer, we can say the treatment prognosis. That's it. Okay, so this is the basic. I briefed it shortly. So yeah, doctors, I have covered most topics where questions is always asked. So rest all in your hand. I know that you will do very well. So go through these things before and then go in a chill manner. Don't go with anxiety at all. That will spoil half of your answers and whatever you studied. So sleep, whatever you've done, it's enough. Go and sit, give your exam, and definitely many good things will happen. You will get good things. Okay. All the best once again. Do well. We'll check after the exam how the questions have come under. We'll discuss again later. Okay. Yeah. Take care.